and also ఏంటి తెలుసా మార్నింగ్ నేను పడుకునేసరికి ఇప్పుడు 3:34 6:30కి డోర్లన్నీ ఓపెన్ చేసి లిటరల్ సాయంత్రం ఏంటి రాత్రి లేట్ వచ్చి పోతున్నాం పడుకుంటుంది మమ్మీ పెరుగుబడాలి మోహన్ అట్లా ఎలాగైనా దగిపడి రూమ్ లో పంపించడానికి ఎక్కడ వస్తుంది నిద్ర మమ్మీ నిద్ర రావట్లేదంటే సెవెంటీ పంపించేసింది పడుతుంది మంచిగా చూసుకోండి పంపించేసాను
Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. 10,000 questions, 10 years recapitulated in the 10 days. All 10. So this will give you a kind of a intuitional power tomorrow in the real exam, at least to make some good guess. I'm very happy. These sessions are becoming very premium and a lot of students liking it, this last moment revision. So let's make this great and big. Good to see Srujana, Sriram, Kistiji Pachauri, and thanks to Vinisha, Mithuna. What happened to Diksha?
On the way.
Coming?
Yeah. Anam is also on the way.
And Kaushik.
Kaushik is not.
Anand?
Kaushik left.
Huh?
Kaushik left this now.
Ayyo.
By missing that is question paper.
No.
It's connecting a bit, sir.
No.
In between the sessions. We tried our max to pull him back, but then it's like.
So let's make the great beginning, doctor. So, how do you make the best use of these sessions? You make the best use of these sessions if you drastically enter what you think as the possible answer, right? Without any delay, actively participate in guessing, then we can really do it very, very fast. Cytotrophoblast, what does it invade? Decidua basalis is what you need to remember. So they invade the endometrium and form the placental barrier. The basal layers of the endometrium are called decidua basalis is invaded by the cytotrophoblast is what you need to remember. Dacron vascular graft is what type of graft? It is a textile synthetic graft and is used in the vascular graft because of its high biocompatibility is what you need to remember. So what is the dangerous area of the scalp, doctor? It is the subeponeurotic loose connective tissue where you have a lot of vasculature is what you need to remember. It contains the middle meningeal artery and vein, which are the main sources of the bleeding. Deltoid ligament is attached to? Huh? Oh, 1 minute. I'll just change my network. Oh, no, network is changed, no? Right now we are in 5G network only. Should not be a problem. Yeah, sometimes. Right? So now, deltoid ligament is attached to all except. So you should know that. इसके पहले क्या पूछा था एग्जामिनर ने? Ankle ligaments. So today only, please make a note. All the ankle ligaments, and you need to be sure to revise the ankle ligaments, which is very, very high age. So the deltoid ligament is a fibrous band attached to medial malleolus, tibialis posterior tendon, sustentaculum tali, and the navicular bone. It does not attach with the medial cuneiform. సురేష్ మిగతా క్వశ్చన్స్ కూడా రెడీ చేస్తారు కదా మన వాళ్ళు ఇట్లనే కొంచెం ఆ టాపిక్ లిస్ట్ స్టడీ చేయండి 1130 టాపిక్ లిస్ట్ ఇస్ దేర్ నో Very good. Kistiji Desi Champ. Oh, what a nice name. Right. Deoxygenated blood is not seen in. Huh? Ah, correct. Left atrium undale. Answer is wrong. Correct. Pulmonary vein should be the answer. B should be the answer. Correct. Thermoepidermal burn is what degree burn? 2. Dermoepidermal is a second degree burn. It is caused by a combination of thermal and chemical agents. First degree burns are the mildest and the only damage the epidermis. And the third degree burns epidermis, dermis, and sometimes the underlying tissue and organs. A bone good. So once more, what is the high yield topic? Burns and degree of burns. You need to be doubly sure. Once more, next NEETPG, they are going to ask the same. Good. Development of labia majora is from, it is from genital swelling. How is genital swelling formed? It is the fusion of the urogenital folds laterally and the genital tubercle medially. Urogenital sinus is derived from urogenital folds and in part of urogenital system. Mullerian ducts are typically the ones which give rise to uterus, fallopian tube and upper vagina. Genital ridge is the ridge of the tissue from which the external genitalia develop, right? So be very sure. Once more, doctor, what is the examiner's very high yield topic in the question bank? Already I gave in the notes. All these things are there in the embryology of the genitourinary system in the 1200 pages notes that I gave you. So please kindly revise. Disc prolapse is common in T3 में thorax. L4, L5, L5, S1, C6, C7. C6, C7 is very common.
So commonest is L4, L5.
Huh? Commonest is?
Most common.
Disc prolapse is most common L4, L5 and L5, S1. And less, and also in C5, C6. Distal end of the humerus develops from how many centers? 4. So 2 primary centers, 2 secondary centers. Primary centers appear during 8th week of embryonic life and secondary centers at 4 to 5 years. एक बार forensic textbook में ossification centers, once more they will repeat the same. Capitate when, hamate when, how many centers, at least for long bones, femur, right? Carpal bones, humerus, at least femur, because femur definitely aayega next NEETPG mein. Good to see 33 online students. Very good, doctor. Huh? అరే ఏం క్వశ్చన్ అంటే మీరు భలే ఉన్నారు. Esophageal constrictions are there, no? It's a very important question. What are you talking? Don't put a finger and try to check in the exam hall. Esophageal constrictions ఉంటాయి కదప్పా. అంటే ఈజీ క్వశ్చన్ అంటారా? ఓకే, అట్లా అయితే పడలే అమ్మా. 15 centimeters from the నాకు తెలియదు ఇది, మీకు తెలుసా? Okay, good. Yes. Distending capacity of the lung is maximum at, actually the apex of the lungs have the distending capacity farthest point from the diaphragm, and the base of the lungs has the least distending capacity. Duct of Bellini. ఇది గెస్ కొట్టచ్చు. కిడ్నీ. Duct of Bellini is kidney. The elastic fibers of tunica media are secreted by, I think this is not a relevant one. Okay. Next question. Elastic fibers of tunica media are secreted by? Fast. Smooth muscle, which are the main component of tunica media, and they cause the contraction and relaxation of blood vessels, right? Then engaging diameter in face presentation, submento-bregmatic. So all the fetal skull dimensions, longest to shortest, in different presentations. Similarly, maternal pelvis also, diagonal conjugate, All the funda are there in the examiner's question bank hit list. Esophagus is present in.
All except anterior.
Thank you. So, middle mediastinum, posterior and superior, but not in anterior. Superior mediastinum contains thymus and brachiocephalic veins. Middle contains pericardium, heart, the great vessels, and trachea. Anterior, thymus, lymph nodes, and internal mammary vessels. Esophagus is present in which medium? Mediastinum. Once more, it is typically present in posterior mediastinum. Ethmoid infundibulum lies between bulla ethmoidalis and uncinate process of ethmoid is what you need to remember. The hiatus semilunaris is the opening of maxillary sinus. Inferior meatus is the opening of the nasolacrimal duct. But when you do dacryocysto-rhinostomy, it is opened into middle. Correct. Excretory system of kidney is derived from metanephros. Metanephros is the definitive kidney in the embryo, derived from intermediate mesoderm. Right? Ureteric bud is a outpouching of mesonephric duct and gives rise to ureter and collecting ducts of the kidney. Once more, in the notes that I gave to you, genitourinary embryology, doctor. Almost second time this question is repeating in the past 10 years. Right? Genitourinary embryology, Mullerian duct derivatives, Wolffian duct derivatives, right? What are the things given by prostate, etc.? You need to be 100% ready to revise for the exam. So somebody asked, sir, how to make the best use of this rapid round? Just to take a paper and pen and make ready what part of the notes, 1200 pages notes I gave you, that you need to go back and do revision. So that is what you need to decide and quickly revise that. That's all. That is the only secret. The moment we finish 10,000 MCQs revision in next 8 days to go, you know most of the things that examiner want. That is a simple secret. Facial nerve is derivative of which branchial arch? Bah, only. Fallopian tubes are part of? Too much. I mean, that's a bad frame of question. No, that was not the original question. It was a wrong frame. Limbus fossa ovalis. Situated above fossa ovalis in right atrium, also called annulus ovalis. It is situated in the interatrial septum. And actually, limbus fossa ovalis is derived from septum secundum. I think answer should be annulus ovalis is foramen ovale. ఒక్కసారి మళ్ళీ ఇది రీచెక్ చేయండి. Female genital tract develops from Mullerian duct. Female urethra develops from urogenital sinus. It is derived from the endoderm of the cloaca. The mesonephric duct in the male urethra, mesonephric duct is the male urethra's developmental precursor.
For male it is mesonephric, for female it is urogenital.
మళ్ళీ ఒకసారి చూడండి, ముల్లేరియన్, వుల్ఫియన్, very high yield. Fencing attitude of the dead bodies is due to coagulation of the proteins. They remain like that, no? If they are reading NEETPG notes and die, they will be like this. Fibrous stroma of the liver is derived from septum transversum. which is the mesenchyme. The foregut endodermal mesenchyme gives rise to pancreas and gallbladder. Midgut endodermal mesenchyme gives rise to small intestine. Hindgut endodermal mesenchyme gives rise to large intestine. First carpal bone to appear? Cap. First incisor to erupt? నిన్న ఏం చెప్పినా మీకు డెంటిషన్ చదవకుంటే you are gone. Temporary teeth, permanent teeth, when do they erupt, what age, how many teeth will be there, everything on the teeth. Lower central. First to erupt in primary dentition usually at 6 to 7 months. Upper central incisor is second to erupt for the primary dentition at 8 to 9. Lower lateral incisor 10 to 11. Upper lateral incisor 12 to 13 is what you need to remember. Very good. Very good. Kistiji, Pachauri, Hrithik Jha. Keep punching your answers. That's how at least you will know. Please, along with the question number, you punch the answer so that we will be knowing. First rib is not related to? Huh? Good, T2 nerve. Sympathetic chain, scalenus anterior, suprapleural membrane, all of them are the relations. First sign of puberty in children, in female is? Thelarch is? So which stage? Stage 2. Is prepubertal stage. Mala, what is the hit list you will write? Examiner question bank में Tanner's staging है और एक बार एक MCQ Tanner पे आ गया, if you are not prepared अच्छा नहीं लगता, right? So Tanner stage 1 is prepubertal, stage 2 is the thelar, pubarch is stage 3, axillary hair is stage 4. Floor of the fourth ventricle has vagal triangle, which is the inverted triangular area formed by the two inferior cerebellar peduncles, which connect the medulla, no?
Yes.
So the medulla is connected to the cerebellum through inferior cerebellar peduncle, and that's what you need to remember. Tuber cinereum is part of hypothalamus. Mammillary body is a round eminence under surface of brain. What is the condition where you find hemorrhage in mammillary body? Fattuman cheppala, which vitamin deficiency? Thiamine. Corticosteroids ante idega. Mammillary body. Mammillary body is associated with what? Memory. That's the reason there is a memory loss. Floor of petit triangle అని చెప్పినా అన్ని ట్రయాంగిల్స్ చెప్పినా కానీ మనం చదవం. Petit triangle, lumbar petit triangle, internal oblique. Fascia transversalis is a thin sheet that runs from the ribs to pubic bone and forms the floor of. Fascia transversalis ఉందా దీంట్లో ఆప్షన్? అదొక్కసారి చూడండి, డి కరెక్టా కాదా అని. పెటిట్ ట్రయాంగిల్ బౌండరీస్ ఒకసారి మళ్ళీ చూడండి. पेटिट ट्रायंगल का बाउंड्रीज और एक बार क्विकली चेक करो. गुड डॉक्टर. So slowly खेलते 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 खत्म करना है. There is nothing big deal about it. Morning you keep 5-6 hours to read yourself and give a 5 to 6 hours dedicated time to me.
So number 9, site of posterior abdominal bounded above and medial with ventral node latissimus dorsi.
చెప్పండి, మళ్ళా క్లియర్ గా చెప్పండి.
Above and medial, sir.
above and petit triangle बोल रहे हैं ना? हाँ, above and medial क्या होता है?
Above and medial is latissimus dorsi, sir.
Latissimus dorsi is above and medial. Then
and laterally and left.
lateral and left.
External oblique muscle.
External oblique is
Lateral and left.
lateral and left.
Sir, at bottom is internal oblique and transverse abdominal muscle.
ఎక్కడ?
Bottom, sir, is internal oblique and transverse abdominal muscle. Sir, ఇంకా ఈజీగా చెప్పనా? Posteriorly by latissimus dorsi.
Posteriorly by
Latissimus
dorsi.
Anteriorly external oblique.
Anteriorly external oblique, obviously.
Superiorly iliac crest.
Superiorly iliac crest.
Inferiorly
Inferiorly,
iliac crest.
inferiorly iliac crest. Floor,
Floor is by internal oblique muscle. Internal oblique muscle.
flora. ఆప్షన్స్ లో ఉందా? ఇంటర్నల్ ఆబ్లిక్ ఉంది కదా, కరెక్టే ఇది ఆన్సర్. నాట్ ఫేషియల్ ట్రాన్స్వర్సాలిస్.
Not face.
ఇంటర్నల్ ఆబ్లిక్ ఈస్ కరెక్ట్ ఆన్సర్. ఓకే,
Transversalis muscle is floor is both internal oblique and transversalis muscle.
ఇక్కడ ట్రాన్స్వర్సాలిస్ లేదు కదా.
The floor of the face.
Okay, internal oblique for now. Okay. Then oculocardiac reflex. What is true? It's also called Aschner phenomena. There is a bradycardia following traction of extraocular muscles. Reflex is more sensitive in neonates. And what mediates it? Trigeminal and vagus, not the oculomotor and vagus. Which one? Oculocardiac reflex. और एक बार oculocardiac सुनाई दिए तो देखना, नहीं तो भूल जाओ, टेंशन नहीं है. At least one more repetition if it is there means examiner is obsessive about it. Stomach is open through greater curvature. Greater curvature. It is greater but curvature. Fossa incudis. Short process of incus. Is a depression in the short process of incus. The head of the malleus is the most superior part of malleus. Long process of the incus is thin cylindrical structure. Footplate of the stapes is most inferior part of the stapes. And what is it abutting? Oval window of the cochlea.
Round is round, sir, through which we give medicines.
అదంతా గుర్తుంది కదా, ఎండోలింఫ్ పెరిలింఫ్ సర్క్యులేషన్. వాట్ డస్ అ ఓవల్ విండో రౌండ్ విండో విల్ డూ?
ఓవల్ పైన ఉంది సార్, రౌండ్ కింద ఉంది.
రౌండ్ కింద ఉంది.
ఓవల్ విండో దగ్గర ఫుట్ప్లేట్ ఆఫ్ స్టేపిస్ ఉంటుంది. రౌండ్ విండోలో అది మనం విక్ పెట్టి we will give medicines కదా. And I think కిందది ఎండోలింఫ్ సార్.
एक बार एंडोलिम्फ पेरीलिम्फ ओवल विंडो राउंड विंडो एक राउंड टच बेस करो. Because definitely examiner's favorite. Fossa ovalis closes because of fusion of septum, primum and secundum. This is once more third time examiner repeated. That's the reason embryology of ASD and VSD.
This was a 3-mark question, common 3-mark question for us.
Favorite question. So once more after exam is over, you will say, sir, all the things that we thought are going to repeated. 4 carpal bones are present at what age?
5 years.
4 years. This is the age at which carpals ossify. The carpal bones are 8 bones that make up the wrist. And they are the first bones to ossify. Fracture of which bone causes leakage of CSF through ear? ఇయర్ ఏది నోస్ ఏది ఓటోరియా రైనోరియా Peter's part of temporal bone. Peter, function of saccule, अंत मरी एथमॉइड. फंक्शन ऑफ saccule क्या है, macule क्या है? फास्ट గింత టైం ఎక్కడ ఇస్తాం మేము, ఈ మళ్ళీ ఆలోచిస్తున్నారు. Saccule is located in the inner ear that senses the linear acceleration. అచ్చా ఇది కూడా ఉంది కదా, ఏ కూడా ఆన్సరే. ఏంటిది? 1 minute. 1 year ki hamate. Very good.
Okay, next ఇంకొకటి capitate కూడా 1 year వస్తుంది.
Capitate comes 1 week later.
1 year.
1 year.
Capitate is first of year. Capitate appears at 2nd month. Okay, 3rd to 4th month is hamate. 2nd month is capitate, sir. 3rd to 4th month is hamate.
3rd to 4th month is hamate.
3 years is by pisiform. Pisiform kaadu. Triquetral.
When?
Triquetral, sir. Triquetral, sir.
Triquetral at
3 years.
That's the reason. No, he said, okay.
Sir, lunate is by 4 years. Correct, by lunate is by 4 years. Lunate is by 4 years.
Lunate is by 4 years.
So, 4 months at the age of 4 years. 4 years.
Good.
5 years is scaphoid. 6 years is trapezius.
అదన్నీ మీరు చదవాలి. సో linear acceleration and angular acceleration is what semicircular canals. Glans penis is a continuation of corpora spongiosum. The whole man's world will feel sad if you answer it wrong. Because they themselves anyway will answer wrong. Ischiocavernosus is needed for penile erection. Glomus cells are found in chemoreceptors. Glomus jugular arises from hypotympanum, not epitympanum. Glomus tumor is seen in distal part of the digit. అది కోసి బొమ్మ కూడా చూపించిన నేను, అయినా మీరు మర్చిపోతే ఏం చేయాలి? దే విల్ ఓపెన్ అప్. నెయిల్ బెడ్ లో ఉంటాయి కదా గ్లోమస్ ట్యూమర్. మరి glycosaminoglycans are not present in cornea. Which one is that? Which is not present in cornea? Very good guess, sir. Heparin is not present in cornea. Keratin, chondroitin, all of them are present. Great cardiac vein lies in, I already told we should revise cardiac vein and coronary venous supply and arterial supply. Yesterday homework, yesterday only you finished. Before I come next day, then only you will finish quickly for NEETPG. See, I am telling you, out of 200 questions, if you are you should anticipate 160 standard. There's nothing what was not asked in the past 10 years will not be there. बोल के कुछ भी नहीं रहता. No surprises. 160 are like marriage day को marriage day cake, birthday को birthday cake. Suddenly 40 questions will be like surprises, funerals, right? Miscarriages, abortions, वो सब 40 questions की रहता. So उसको टेंशन नहीं है. बट ये 160 को अगर if you don't deliver right, which are asked in the past 10 years, then examiner will feel bad. Right, doc? So, good, very good, very good. Now, great cardiac vein lies in anterior interventricular septum and drains into coronary sinus, is what you need to remember. Right? Grimace in Apgar score is how much?
3.
అట్లా ఎట్లుంటుంది?
అవును అప్పుడు 0 ఉండాలి కదా సార్.
అబ్గార్ స్కోర్లో 0 ఉంటుంది, 1 ఉంటుంది, 2 కూడా ఉంటాయా?
0 to 2 ఉంది కదా సార్ స్కోర్ రేంజెస్. మర్చిపోయిందా?
Grimace has a score of 1.
All the
5 parameters, 5 into 2 max.
yes.
3 ఎట్లుంటుంది? గ్లాస్గో కోమా స్కేల్ 0 ఉండదు. అబ్గార్ స్కోర్లో ఇండివిజువల్ పారామీటర్
0 only sir, 0 indicates that the newborn has no response to stimulus.
కరెక్ట్ మా. గ్లాస్గో కోమా స్కేల్లో నువ్వు 0 చెప్పినావు, తప్పు. అది మినిమం 3 ఉంటుంది. ఇక నువ్వు అబ్గార్లోనేమో 3 అని చెప్తే గ్రిమేస్కి నేను ఏం చేయాలి? ठीक है, लिख लो अबगार अपने आइटम्स में डाल दो, सुपरमार्केट में डेटॉल बॉटल अबगार स्कोर ऑसिफिकेशन सेंटर्स वो पूरा अपने लिस्ट में डाल दो. ग्रुप बी नर सर మైలినేటెడా నాన్ అన్మైలినేటెడా? నర్వ్ ఫైబర్ క్లాసిఫికేషన్ చెప్పకుండా ఒప్పుకోను నేను. Nerve fiber classification I told no, which is myelinated, which is not myelinated, which is fastest to transmission, which is hypoxia sensitive, pressure sensitive, anesthesia sensitive. Adi you know. But idi kuda you know. Please know. Sympathetic preganglionic.
So it's myelinated.
Huh?
Myelinated. Myelinated. Is it myelinated, sir?
Obviously, only C is unmyelinated. మళ్ళీ ఒకసారి రాసుకోండి. నర్వ్ ఫైబర్ క్లాసిఫికేషన్ సూపర్ మార్కెట్ లిస్ట్ में डाल दो. Haller cells are seen in orbital floor. ఇక్కడ ఉంటుంది కదా ఇథ్మాయిడ్ దగ్గర, మీడియల్ పార్ట్ లో. Are ethmoid air cells located in the orbital floor? Hazel's corpuscles? No God, it is epithelial cells. God, tell me God. నిన్ననే కదా డిస్కస్ చేసేది మీరు. మళ్ళీ జర్మినల్ సెంటర్ అంటే ఏంది? హాజల్ బతికించిన. మళ్ళీ నేనేం చెప్పిన నిన్న? NEETPG క్లియర్ చేయాలంటే వాట్ ఈస్ నీడెడ్ టు క్లియర్ NEETPG? కంపల్సరీ థైమస్, స్ప్లీన్. పర్లే, ఇప్పుడు గుర్తుపెట్టుకోండి. 4-5 అకేషన్స్ ఐ విల్ గివ్ యూ 4-5 ఛాన్సెస్ టు గో ఇన్ ద టైమ్ మెషిన్. 10 years old NEETPG papers. lymph node, spleen, thymus, histology. जो नहीं पढ़ के गया वो मर गया, जो डर गया. ठीक है. Hostrations are present in, इसलिए अल्सरेटिव कोलाइटिस में क्या बोलते हैं? लेड पाइप colon is the one which lost its hostrations because they are present in colon. Hinge fracture is, నిన్న ఒక పాండ్ ఫ్రాక్చర్ వచ్చింది. డిప్రెస్డ్ ఇంకోటి ఏంటి? ఇంపాక్ట్. హింజ్ ఫ్రాక్చర్ ఈస్ basilar fracture. Is a type of basilar fracture, a fracture at the base of the skull. How many lactiferous ducts open into nipple?
50 to 20.
బా, ఏం ప్రిసైజ్ చెప్పినావు, సూపర్. నువ్వు టాపర్ అక్క. 15 to 20.
आपके मुंह में दही
Human placenta is correct. It has blood. It is discoid, hemochorial, deciduate. Anterior perforators are seen in mid thigh. Are seen in the mid thigh. So once more, लिख लो dots, perforators, पूरा varicose veins का perforators. परफोरेटर वेन का प्रॉपर नाम क्या होता है? लिख लो और रिवीजन करो. Hyoid lies at the level of నిన్న trachea bifurcation carina T4 base of T4 carina Karina. Still that is fine, no? కరెక్ట్. కరీనా అంటే 5 ఉన్నాయి కదా దీంట్లో. Hyoid lies at the level of C3. C5 is the level of thyroid cartilage. C7 is the level of suprasternal notch. T2 is the level of sternal angle. గుర్తుంటదా? Okay, actually one cartilage was given and it was fibrocartilage was given. Identify the muscle with its nerve supply. Actually what was given was rhomboid muscle was given and dorsal scapular nerve is the one which was supplying it. If a claw hand develops in a patient of leprosy, what is the deformity? Grade 2. Grade 0 is normal hand. Grade 3 is severe deformity with total flexion of the fingers and thumb. I mean, this is a stupid question actually. The point is, this won't repeat, but just for fun. If anal sphincter is injured, which degree perineal tear? Good. 3. ఇంకా లోపల పోతుంది. It involves disruption of rectal mucosa. In a muscle fiber at rest, the length of I band is 1 mm, A band is 1.5. What is the length of sarcomere? ఎందుకు 1.5 minus 1 నా?
Shorter అయితే కదా సార్, ఇట్స్ యాక్టివ్. at rest అంటున్నారా? ఓకే, then
ఏది మధ్యలో ఉంటుంది?
I is in center. A band is what? Slides.
Outer.
Active slides over miles.
Distance between two Z lines is the length of sarcomere, which is equal to the length of the I band plus twice the length of A band. Twice the length of A band 4 ఉండాలి కదా ఆప్షన్ అప్పుడు. ఇది ఒకసారి చూద్దాం. Will 4 should be ideal. In neonate, kidney is supplied by aorta. In the neonate, right?
Even in adulthood, it is
Renal artery, which originates from aorta. In Einhorn, constriction develops usually at which interphalangeal joint of? Little toe. మీరు ఒక బొమ్మ చూడండి ఐన్హమ్ది. गूगल इमेजेस में एक आइनहम का चेहरा देखे तो समझ में आएगा वो लिटिल टो या बिग टो बोल के. In the arm, Allah ने arm अलग है, forearm अलग है, shoulder अलग है, wrist अलग है. तो हम पूछ रहे arm में Allah ने gives rise to which muscle? Both.
Sir, you know, Adana is
One minute. Flexor carpi ulnaris and flexor digitorum profundus. Right? So ulnar nerve is the major nerve of the arm that supplies the medial aspect anyway. In articular cartilage, the most active chondrocytes are seen in zone 3. They produce the extracellular matrix. Zone 1 is deepest zone, least active. Zone 2 contains less active. Zone 4 is superficial zone and contains once more least active.
Zone 3 is most active, zone 1 is least active.
Axillary nerve paralysis, what is except?
Dialogue is wasted. Extension of shoulder with arm abducted to 90 degrees is impossible. Yes. Small area of numbness is present over shoulder region. Yes. Patient cannot. They can initiate. No, abduction is not there. False statement.
Wasting of deltoid muscle, inability of the shoulder with arm to extend the shoulder with arm abducted to 90 degrees, and regimental badge area mein there is development of numbness. The patient can still initiate abduction. In cardiac muscle, where are the T-tubules present? Once more, sarcomere structure. Z-lines are the area where T-tubules are present. So what is favorite area without studying? If you go to exam, you are clean bowled. Sarcomere. What is A band, I band, H band, Z band, Z-line? What happens to them during the muscle contraction? Once more, हमारे 1200 pages notebook में सब चीजें हैं, हम discuss भी कर चुके, so please kindly do the revision. In case of aberrant obturator artery, from where does it arise? Aberrant obturator artery, inferior epigastric artery, is the most common variant of obturatory artery arising from inferior epigastric artery. In case of female, what is the commonest hernia? Her. Because you male ho, female ho. Indirect inguinal hernia is most common, but listen, but femoral hernia is most vulnerable to undergo strangulation. And if you ask, femoral hernia is more common in female because of the wider pelvis, their femoral canal ring is more wider. This is where is femoral hernia common in adagale? Female lo common ente adigindi. Commonest is in. I told also while teaching, I told very clearly, a lot of times this question they ask. Next time onwards, we'll give a small electric shock and remind you. In infant, bone marrow biopsy is done. Adults may partial iliac crest, all of us know. But infants usually done on tibia. Ask Mohan. Ask Mohan. What is the most common sight in infants? In most cases, kidney is placed retroperitoneally and iliac arteries and veins are used for perfusion and ureter is transplanted directly into bladder. I think this question थोड़ा इधर उधर हो गया. In MRH-KH syndrome, which is absent? What is MRKH? Ayya! Mayer-Rokitansky-Kushner-Hastner syndrome, which is the other name for Mullerian abnormality. We are dismissing you as Foxy president. अरे MRKH बेटा, Mayer-Rokitansky, कभी सुना नहीं? Kushner-Hastner syndrome, which is Mullerian abnormalities, no? Which among the following is absent? उसको testis
Testis is there in the.
testis काय को रहता?
Testis will not be there.
Come on. They have no problem in having pubic hair, breast development or vagina development. There is only absence of uterus and upper part of the vagina. No, Murray. But anyway, testicular feminization syndrome, Mullerian, Mayer-Rokitansky, Kushner-Hastner. Agreed. Then Swyer syndrome, Liklo, Turner, congenital adrenal hyperplasia, pseudohermaphroditism, 3+3, testicular feminization syndrome. ये सब नीट पीजी एग्जामिनर क्वेश्चन बैंक में बैठा हुआ है. 5 पॉइंट्स याद रखो कम से कम. Swyer, Turner, MRKH, testicular feminization, CAH and pseudohermaphroditism. One MCQ from this अगर नहीं आए तो मैं मुरली भरद्वाज नहीं. ठीक है? My promise to all of you. Huh? Obviously, that goes with it. Seminiferous tubules are hyalinized. In Nux vomica poisoning, posture by spine is opisthotonus. In patient with penile injury, cholecysthasia prevents extravasation of urine in ischiorectal fossa. Once more, Liklo. Extraperitoneal bladder rupture, intraperitoneal bladder rupture, bulbar urethra versus membranous urethra rupture. इसके बिना क्वेश्चन पेपर नहीं होगा. These are the words you need to look for in the SCORE app. Today only download Dr. SCORE app and be very sure to use the search feature. You type extraperitoneal bladder rupture. Immediately you will get all MCQs and all the notes related to that in the SCORE app, and then just do a quick revision. That's how in the short time you can. In sexual assault of the child, hymen usually is not ruptured due to? Because it is deep-seated. In thyroid follicle, how long thyroxine is stored? Who knows? 2 to 3 months. It's like asking when will NEETPG results come. In Volkmann's contracture, which artery is involved? Bus. अब्बा सुप्राकोंडाइलर फ्रैक्चर इतने बार पढ़े हम. Most common artery to get affected. Too much work contract. अच्छा नहीं लगा। आईएएस में आना मुश्किल होता, चपरासी का पोस्ट आएगा। Transverse mesocolon is seen in, transverse mesocolon, which vessels are seen? Middle colic artery. Once more, yesterday we had a lot of bouncers now. Superior mesenteric artery, inferior mesenteric artery, pudendal artery, celiac trunk, right hepatic artery किससे आएगा, left hepatic artery किससे आएगा, गैस्ट्रोडियोडिनल आर्टरी कहां से आएगा, स्प्लेनिक आर्टरी का ब्रांचेस क्या है, एपिप्लॉइक आर्टरी लेफ्ट एंड राइट, दे हैव डिफरेंट ऑरिजिन्स। ये पूरा पढ़ना है मेरे भारतवासियों। डेफिनेटली नीट पीजी एग्जामिनर पूछेगा, अगर आप मासूम चेहरा लगाए तो एग्जाम हॉल में चलेगा नहीं। वेरी गुड टू सी 37 online classmates. Good, doctor, keep going. Please inform all your friends. I want to see at least 500 attending. So, anyway, for your recall, left colic is a branch of superior mesenteric artery that supplies descending colon. Ileocolic is a branch of inferior mesenteric artery that supplies ileum. Right colic is a branch of superior mesenteric artery that supplies ascending colon. So, is what you need to remember. Both right and left colic are the branches of the superior mesenteric artery.
Transverse colon 2/3 వరకు superior mesenteric supply చేస్తారు. 1/3 transverse నుంచి కింద వరకు inferior.
So, doctor, our students are the best brand ambassadors. Please drop a line in all the WhatsApp groups, Facebook groups, Instagram, social media, Telegram groups about this YouTube link so that more and more can join. 10,000 PYQs, previous year questions covering all the 10 years of NEETPG questions. We are going to do a revision in these last 10 days before exam. And iske niche aapko, I am typing you the WhatsApp study group joining link. Please inform and share it with your friends so that we will update you with a lot of MCQs and the upcoming sessions, etc. So nice to see Soundarya ready and many more who are all online. Now, doctor, incised looking laceration is seen in all except. Come on, subcutaneous bone होना है उसके लिए. Good. Bone unte inside looking that are typically exposed to sharp objects. Chest is usually, there is a lot of muscles, right? Index finger infection spreads. Thenar. Once more, liklo. Thenar, hypothenar infection spaces and palmar space and tenosynovitis. Tenosynovitis. These are the favorite areas for the examiner, doctor. The space between the thumb and index is the thenar space. Thumb and index. Mid palmar is located between thenar and hypothenar. Hypothenar is located between little finger and ring finger. Right? And also the palmar areas are divided into zone 1, zone 2, zone 3, no man's land. वो सब हमने ऑर्थोपेडिक्स में ऑलरेडी रिवीजन कर करके बुढ़े हो गए. तो आप जरा फिर पढ़ना है डॉक्टर. नहीं पढ़े तो any teacher will fail if the students don't at least give one revision. Indication, you mark it, no? The areas of surgical compartment release in compartment syndrome when? Very good. 30. Excellent. Manchi gurtupeట్టుకున్నాం. Inferior epigastric artery is boundary of Very good. Good to see 44 online classmates. हम बहुत खुश हैं. Now, inferior epigastric artery forms the boundary of Hasselbalch's triangle. Once more. One of the favorite questions of the examiner is inguinal canal boundaries. What forms roof? What is floor? What is anterior wall? What is posterior wall? Everything. Right? Now correct answers will come. ఇగో భరత్ ఇప్పటిదాకా వీళ్ళందరూ బోర్ కొట్టిస్తుర్రు. అన్ని తప్పులే. మళ్ళీ మీదికెళ్ళి నన్ను బెదిరిస్తుర్రు. Now, आ गया अर्जुन करण आएगा. Inferior pancreaticoduodenal artery is the branch of superior mesenteric artery. మళ్ళీ నేనేం చెప్పినా మీకు సూపర్ మార్కెట్ లిస్ట్ में लिख लो. Superior mesenteric artery, inferior mesenteric artery, pudendal artery, interiliac artery, exiliac artery, iliac, celiac trunk, and aorta branches. At which level each of these arteries are arising? One question on the artery will come. Barabar? So the inferior pancreaticoduodenal is a branch of superior mesenteric. ఇప్పుడు ఇంకో పోనీ కేల్తే పడేంगे. Splenic artery is a branch of celiac trunk. Left gastric artery is a branch of celiac trunk. Gastroduodenal artery is a branch of common hepatic artery. Superior mesenteric artery is a branch of abdominal aorta. Inferior rectal artery is the branch of మంచి చెప్పినాం. Alcock's canal. You remember, right? So inferior rectal artery is the branch of internal pudendal. Understand? Right. Infraspinous fossa of scapula contain which muscle? Infraspinatus. ఇంకేముంటది? పేద అదో మళ్ళీ తొక్కల క్వశ్చన్. Infundibular diverticulum is the extension of third ventricle. The third ventricle is a narrow cleft-like space between the two thalami. ఏ వెంట్రికల్? గుండెల వెంట్రికల్ కాదు, దిమాక్లా. दिल का वेंट्रिकल नहीं है मेरे भाई, दिमाग का. Okay, we will do advertisement. Join our NEETPG coaching. At least you will know which ventricle is which. Renal arteries are branches of branch of aorta. Wrong answer. This is wrong answer.
Just now we got one question.
No, Adi. Just not only because of that, it is the branch of aorta. Then the key was wrong. మధ్య మధ్యలో ఒకటి రెండు తప్పులు వస్తుంటాయి. Intercalated disc is present in. Come on, chiller question. Cardiac muscle. Internal anal sphincter is part of. External internal anal sphincter is there, no? Internal circular fibers form the internal anal sphincter. Puborectalis is part of levator. Deep perineal muscles are composed of sphincter urethrae, compressor urethrae, and deep transverse perineal. Internal longitudinal fibers are part of rectal wall. Internal circular fibers will form internal anal sphincter. Internal capsule, all are the parts except. Huh? Anterlimb, sublentiform, retrolentiform. There is no prelentiform. Well, prelenti indi. Already we are studying in lenti season. Internal spermatic fascia is derived from fascia transversalis. Where are you, man? Which gives rise to internal spermatic. External oblique is located in lateral and anterior part of the abdomen. Intracapsular but extra synovial is long head of biceps. Who said? కొన్ని వేస్తుంది మధ్య మధ్యలో బాంబులు వేస్తుంటుంది. Long head of biceps. Just before birth, which epiphysis appears? ఇట్లా గైనకాలజిస్ట్లు ఆబ్స్టెటిషియన్లు ఎండి గైనాబ్స్ you will be banned from entering if you answer this question wrong. Lower end of femur ko check karte na to know the maturity. Keen box is osteochondritis of Killian's deficiency is in inferior constrictor. Good. Killian's deficiency is seen in cricopharynx. You said crico? Good. Good guy. Corner septum is? Huh? Petrosquamous suture में होता है corner septum. Corner septum is thickening of petrosquamous suture located between petrous part of temporal bone and squamous part of temporal bone. Once more was asked, corner septum is seen in petrosquamous suture. Landmark of pudendal nerve block is ischial tuberosity. Super. Langerhans cells are seen in which layer? Spinosum. Spinosum में keratinocytes untai kada. Once more, what is the favorite topic? Topic pakdo. Skin layers. Which layer has what? Why this कोलावरी दी sure आएगा कल के नीट पीजी में. So 1200 pages notebook में 50,000 high yield facts में dermatology में हम already दे चुके. Please do revision. Laparoscope is sterilized by glutaraldehyde. Special, very favorite question once upon a time. Largest cranial nerve? ట్రైజెమినల్లో ఉంటాయి కదా, లాంగెస్ట్ కాదప్పా. Lateral border of ischiorectal fossa is formed by Liclo, ischiorectal fossa, superficial perineal pouch, deep perineal pouch. What are the contents? What are the boundaries? कड़क रहना है नीट पीजी को जाते वक्त, नो कॉम्प्रोमाइज. हाँ, लेटरल बॉर्डर ऑफ इस्क्योरेक्टल, गेस मारो, अभी तो नेगेटिव मार्किंग नहीं है ना. Obturator internus, gluteus maximus. Okay. Lateral border of foot receives its sensory supply from huh?
Very lateral most part is sural. Deep part middle lo untadi. So sural only.
I told no. भरत आ गया, राइट आंसर्स निकलेगा.
But superficial peroneal
Sciatic nerve. Oh, Mithuna. Sciatic nerve goes posterior. You said sural or sciatic? Oh.
is only the first place.
ఏ వాళ్ళకి అవన్నీ తెలియదబ్బా, ఇప్పుడే తెలుసుకున్నారు డీప్ పెరోనియల్ ఉంటుందని. అహో డీప్ ఉంది కాబట్టి సూపర్ఫిషియల్ ఉంది అనుకుంటారు. ఇగోండి, సూపర్ఫిషియల్ ఫిబ్యులర్ ఫ్రాక్చర్ మే ఇంజూర్ అవుతాయి. ఫ్రాక్చర్ ఆఫ్ ఫిబ్యులా. మహబూబ్ నగర్ మెడికల్ కాలేజ్ స్టూడెంట్లకి ఏం తెలుస్తుంది చెప్పుర్రి? ఉస్మానియా అయితే మంచి హుషారు ఉంటారు. देख लेंगे सर, देख लेंगे. अनदर 4-5 दिन में हम भी सूरल और म्यूरल सब कुछ मालूम होता. Saphenous nerve is a branch of femoral nerve. Deep peroneal is a branch of common peroneal. Sciatic is the largest, least diameter of the inlet of gynecoid pelvis is obstetric conjugate. Shortest distance between sacral promontory and symphysis pubis. Then left recurrent laryngeal passes between और एक बार मैंने क्या बोला? वेगस, रिकरेंट लेरिंजियल. ओके, एनीवे, लैरिंग्स का सेंसरी सप्लाई बोलो. वोकल कॉर्ड्स है ना, वोकल कॉर्ड्स के नीचे कौन सेंसरी सप्लाई करता है? रिकरेंट लेरिंजियल नर्व. ऊपर कौन सप्लाई करता है? इंटरनल ब्रांच ऑफ द सुपीरियर लैरिंजियल नर्व. And all muscles are supplied by recurrent laryngeal, except the cricothyroid is supplied by external branch of the superior laryngeal. ठीक है. और एक बार रिकरेंट लैरिंजियल नर्व बोल के स्कोर ऐप में नीचे सर्च में टाइप करो, पूरा उसका हिस्ट्री निकालेगा वो. सो लेफ्ट रिकरेंट लैरिंजियल पास बिटवीन ट्रेकिया एंड esophagus, not between trachea and larynx. Length of eustachian tube, try करो. हाँ बोलो. 36 अप्पा. ఇంకేం ట్యూబ్ అనుకున్నారన్నా? Not this. Pharyngotympanic tube. Length of posterior vaginal wall more than the anterior vaginal wall. Posterior vaginal wall is longer than anterior wall, which is approximately 3 to 4 centimeters in length. Length of tibia is what percentage of height? ट्राई करो
20%
एक एक टेप लेके जाओ कितना 20% डालेंगे अब మంచిగా చేసుకుంటున్నావు अम्मो विनीशा कभी डर लगता है मुझे
full height
level 1 support of uterus and vagina
uterus
1/5 20% हाँ
all of the above. Uterus supports of uterus ligaments.
uterosacral most important support to uterus and vagina Leydig cells of the fetus secretes
Ladies is testosterone. Testosterone.
నిన్ననే చెప్పుకున్నాగా subtly the structural subtly produces Mullerian inhibiting hormone also blood test is barrier is all subtly
Blood test is valid.
only thing LH I mean Leydig cells are testosterone so remember Mullerian inhibiting substance by subtly cells ligament which prevents spleen to fall into left iliac fossa when it enlarges is the spleen will be enlarging from left to right instead of down because of phrenicocholic ligament ligamentum arteriosum is derived from ductus arteriosus once more doctor all the fetal circulation ka embryonic precursors and adult counterparts favorite question of the examiner right so then line from midinguinal point to adductor tubercle represent adductor tubercle femoral artery रहता ना tomorrow when you have to do any intervention how will you identify femoral artery midinguinal point ఉంటాయి కదా పల్సెస్ కరెక్ట్ ఎక్కడ పెడితే పల్సెస్ ఇటు వెతుకోవు కదా so you will look for the midinguinal point and you are having the adductor tubercle between the two is the place where your femoral artery is passing. Lips does not drain into which group of lymph nodes? Preauricular parotid glands को नहीं जाएगा, sublingual submandibular को जाएगा. Lip lymph node supply is the hit area. Little area, woodruff area is a favorite area of the examiner. So where is little's area, doctor? Antero-inferior nasal septum is little's area. వెనకాలది woodruff. అబ్బా ఏం చెప్పినావు అక్క. Then location of testis is higher on
Right side. Left side.
boys will get special advantage in answering this question.
They also don't know the answer. Sir, even kidney could allow. So right is higher than left.
No, what is the answer question?
Testis gurinchi, sir, kidney line.
No, right test is usually slightly lower than the
So I said left is higher. Sir.
correct. ఒకసారి మళ్ళీ చెక్ చేయండి.
Because how I remember is even left kidney is higher than the right kidney.
No, basically if you look at the renal artery circulation, right side directly drains into IVC. Left will take a angle and then drain into left testicular vein first drain into left renal vein, which then drain into IVC. So that is the reason any renal cell carcinoma, whenever it is there, it will prevent the left testicular veins drainage. That's the reason any left varicocele, if it is developing rapidly, you should suspect possibility of a renal cell carcinoma. చెప్పండి.
So left testis hands lower and hands at a lower level than right.
Correct. So right is higher, left is lower.
But the explanation is wrong, sir.
So this answer is wrong. So this is B.
No, sir, it is right. Higher is right.
Oh, right is higher. No. Oh, okay. Left is lower.
Yes, sir, left is lower.
But according to explanation,
The explanation is wrong. This is chat GPT, no? वो कुछ भी बकता है. It's neither male nor female, so he doesn't know what the world is. Lower limit of superior mediastinum is at which level?
superior.
T1 vertebra. Lower limit of inferior border of the lung in the mid-axillary line is? Come on. Eighth rib. Inferior border of the lung in mid-axillary line is eighth rib. And I mean 3 levels. One is at anteriorly mid-clavicular, other is mid-axillary, one is posteriorly. 6, 8, 10 is lung. 8, 10, 12 is pleura. Lymph drainage is increased from lower limbs by thigh center. Lymphatic drainage of lateral wall of nose, deep cervical, retropharyngeal and submandibular. Lymphatic drainage of the ovary, para-aortic lymph nodes. McEwen triangle is the landmark of mastoid antrum. Then where is McEwen triangle? Bony cavity. Where is antrum? Antrum is the cavity in the petrous part of temporal bone. Major supply of medial surface of cerebral hemisphere. Medial.
Medial, anterocerebral,
Anterocerebral. That is the place where your contralateral lower limb is hanging. That's the reason anterocerebral artery stroke में क्या होता है? Contralateral lower limb monoparesis typically. मतलब राजकोंडी सर्किल ऑफ विलिस एग्जामिनर के हॉट स्पॉट है सेरिब्रोवास्कुलर एक्सीडेंट में एसीए, एमसीए, पीसीए, पाइका, आइका, पिकॉम, पिकॉमा, पिकॉम भी है क्या? पिकॉम का सीवीए फीचर्स भी होता है. अब एन्यूरिज्म ओके. सो जरा ये एक मर्तबा धोबी घाट को लेके जाओ. तो मल्लम पट्टी क्लासिफिकेशन इज फॉर before intubation you are looking for adequacy of ease of intubation. So since ये है ना, इसलिए मल्लम पट्टी का इमेज बेस्ड एमसीक्यू आता है. हर एक नीटीपीजी में मल्लम पट्टी का इमेज बेस्ड. एक ध्यान से देख लो मल्लम पट्टी. Both forces appearing, what level of Mallam Patti, etc. Marcus gun, your favorite. Jaw winking phenomena is in relation to which cranial nerve? Aberrant innervation between third and fifth cranial nerves is called as Marcus Gunn jaw winking phenomena. Marcus Gunn pupil alag hai. Marcus Gunn pupil is in rapid relative afferent pupillary defect. So whenever there is, you have one eye, another eye, and there is one optic nerve. So whenever the light is falling and optic neuritis is there, then it is not carrying the direct reflex, pupil reflex, nor even contralateral pupil reflex. The moment you move the torch to the other normal eye, that eye is direct and this eye is consensual. Both will work. So that lead to pupil constrict. So क्या हो जाता practically जब light डाले तो वो constrict नहीं हो रहा. But the moment you move the light to the other eye, that eye is constricting and this is also constricting because the consensual reflex. That's the reason this looks like a lazy eye. That is called Marcus Gunn phenomena, which is due to afferent pupillary defect. When you throw the light, the optic nerve carrying it is affected. Huh? Obviously. Different. Once more, favorite questions of the examiner: Redinger, Westphal, nucleus, pupillary pathway, Marcus Gunn, pupil. Then what else? Argyle, Robertson, pupil. Addy's tonic pupil. One of this will come in tomorrow NEETPG exam and Murli Bharadwaj yaad aayega. Another thing, Horner syndrome. How will you distinguish by using cocaine-like drug in the neuro-ophthalmology? I mean, at this juncture, I can't repeat what I already taught. Edi? How will you differentiate whether it is how do you know that it is Horner? By installation of cocaine-like, amphetamine-like drug. So I leave the literature for you to go back to the score app and do review of neuro-ophthalmology. NEETPG is not for 200 but 199, one question from one of these areas, sure short to come. आप कुछ भी करो, रिवीजन करो, अगर आपके समझ में नहीं आ रहे तो बोलो और मैं और एक बार बोलने के लिए तैयार हूं बाद में. Right? If you yourself read, nothing like that. Maxillary bone does not articulate with. Check किया सर, check करना पड़ेगा. Ethmoid frontal, lacrimal, maxillary. Maxilla यहाँ है ना बेटा. Ethmoid is that Haller cells are there. Then lacrimal also close to maxillary. And sphenoid, and frontal. Fronto-maxillary process बोलते ना. Maximum collagen in wound healing is seen by second week. Good. End of second week. Flora of orbit is formed maximum by maxillary. So zygomatic forms lateral wall, sphenoid forms the roof, palatine forms the medial wall of the orbit, maxilla forms the entire floor. Maximum density of muscle spindle is found in lumbricals because తెలియాలి కదా, which are sensories that detect the changes in muscle length and tension. All fingers.
Sir, ఒకసారి explanation చూపించండి.
Huh?
Explanation చూపించండి.
నేను చెప్తా పట్టండి. See, ulnar nerve is musician nerve, median nerve is laborer's nerve. So all fine tuning of the activities all require you to get the idea about how is the tension. Fingers are like vocal cords for a guitarist. That's the point. And what is the mechanism? What is the action of lumbrical bolo? Flex the finger like this. Extension of interphalangeal. Flexion of metacarpophalangeal. वो भूलना नहीं. Very good to see Meghavi Patel, Kishtiji Pachauri, Soundarya, and many more who are all online. Thanks for joining the session, doctor. If you have not yet joined, if at all you have not yet joined our WhatsApp study group, please share this to all your friends and today only join our WhatsApp study group. Very good. Maximum diameter that passes through maternal pelvis is biparietal. Largest transverse diameter of the fetal head is the maximum diameter that passes to the maternal pelvis. Maximum storage of magnesium occurs in Bah. You said bone? Good. The most common site of thyroglossal cyst is? No. This is a favorite question. Subhyoid. Peckel's cave is related to? Famous, no? Gesserian ganglion unte dantla. Trigeminal. It is the place where trigeminal ganglion, Gesserian ganglion. Yesterday what did I tell? Pterygopalatine ganglion, otic ganglion, Gesserian ganglion, celiac ganglion. पढ़ो. Examiner wait कर रहे हैं आपके लिए. Membrane incised during hemilaryngectomy. Cricothyroid. Mesodermal in origin is microglial cells. Glial cells. Astrocytes, oligodendrocytes, and ependymal cells are all ectodermal. Astrocytes are most abundant glial cells. इसलिए astrocytoma, glioma, glioblastoma, they are all mutually same. Glial is the one which provides structural support. Middle meningeal artery passes through నేను చెప్పిన ఫొరామిన్ చదవకుంటే MS जनरल सर्जरी बॉस स्पाइनोसम से जाएगा, which is the hole in sphenoid bone. Foramen ovale, mandibular nerve, male ovale. Then rotundum, rotamax. We used to have a pen, no? Maxillary nerve passes through rotundum, rotamax pen. Modified radical neck dissection include which level of cervical lymph node? 1 to 5. 1, 2, 3, 4, 5. All levels. Once more. Okay, question compulsory appa. MRM. Modified radical mastectomy, modified radical, neckectomy, MRM. What is preserved? What is removed? What is Patty's mastectomy? इवाल रास्कोन रही एंदा 5 मिनट 10 मिनट लगेगा, उससे ज्यादा नहीं लगेगा. बाय द वे सर्जरी बुक और ENT बुक में मिलेगा. मॉडिफाइड रेडिकल नेक डिसेक्शन कौन सा बुक में मिलेगा वो भी हम बता रहे भाई, हमारे पास कोचिंग लिए तो. बुक में नहीं है तो स्कोर में है, स्कोर ऐप में है. मगर वो सर्च मार के जरा रिवीजन कर लो. एक क्वेश्चन आएगा एग्जामिनर का, मोस्ट कॉमन बोन अफेक्टेड बाय ओटोस्टेनोसिस, बोनी लैब्रिंथ, abnormal bone growth in middle ear which affects the ossicles in the oval window and the oval window. The bony labyrinth is most common bone affected by otosclerosis. Most common congenital anomaly of the kidneys, horseshoe. Beautiful. And why horseshoe kidney occur? Because of aberrant vasculature which will prevent it from ascending up. Most common hymen rupture in virgin. पर्दे के पीछे क्या है, पर्दे के पीछे posterolateral. Don't forget. Most common ligament injury in knee injury. Unhappy triad of O'Donoghue. Unhappy triad of O'Donoghue. See, there is nothing creativity in NEETPG exam, doctor. It's very standard. To Padina Jana, that's all, you'll get seat. You don't read what examiner expects and remember them. There. What is needed is just one time knowing it, one time revising it, but more than enough. अब 1+1 भी अगर आप नहीं दिए तो 1,00,000 रुपए पे करके कोचिंग जाओ, नहीं तो प्लान ये ले लो, बी ले लो, सी ले लो, घोटाला हो जाएगा. So what the plan that you need is only Murli Bharadwaj plan. Most common ligament injury is MCL. Most common nerve injury in the fracture of the medial epicondyle of humerus. ये तो cheap चित का क्वेश्चन है, चिल्लर बिस्किट क्वेश्चन. Most common ossicle affected due to trauma. Incus, which is the name of our company. Incus. Most common part of the larynx involved in TB. Posterior. पर्दे के पीछे क्या है, पर्दे के पीछे. Most common sinus predisposed to malignancy. Ethmoidum axillary. Maxillary. Most common site for carcinoma pharynx in female suffering from Plummer-Vinson. Classical. Post-critical. రమ్మని చెప్పండి, మన కౌశిక్ ని ఏం చేస్తుండే పాపం, ఇంట్లో టెన్షన్ పడుతుంది. మీరు అనవసరంగా ఐబత్ చేస్తున్నారు ఆయన. టూ మచ్ చెప్తుంది. క్యారెక్టర్ అసాసినేషన్. We all know that we can't answer. I told you no. PYQ. Previous year question session is only for 2 kinds of people. about to become toppers, और दूसरा एक सफेद कर्चीफ लाके ऊपर लगा के घोटाला डिक्लेयर कर दिया है, हमको 10 दिन में अपने आप कुछ भी करने का टेंशन आ रहा है, बोले तो आओ। सेकंड, मैंने 4-5 महीने इधर उधर जरा तो पढ़ लिया, अभी मैं कंसोलिडेट करके टॉपर बनना है तो भी चलेगा, राइट? सो बट दीज आर द मोस्ट हाई यील्डिंग सेशंस। 10 दिन अगर आप सर्वाइव हुए तो I can guarantee you'll get the seat. Most common site of cystic hygroma, lower third of the neck. Most dependent part of the abdomen in standing position. Pouch of Douglas and recto-uterine pouch. Most suitable type of pelvis in female, gynecoid. Mouth to mouth respiration provide how much oxygen? Sweet 16. Then bugging is compression of forearm के बीच में Harrison बुक लगाओ, मग 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 Harrison. So पूरा गर्ल्स एक हैरिसन, एक नेल्सन, ये सब लगा के పాల బిందె పట్టుకుని వచ్చినట్టు రీడింగ్ రూమ్కి వస్తే బాయ్స్ విల్ లూజ్ టెన్షన్, విల్ లూజ్ కాన్ఫిडेंस. हम तो डेविडसन के रिव्यू के ऊपर रिव्यू का रिव्यू के ऊपर नोट्स को वो भी 3 पेजेस में मिले तो बोलो सर पढ़ेंगे और जाएंगे एग्जाम को, खत्म. How much time we took for 150? 1.5 hours. Not bad, eh?
We're not worried about the time, sir. We have answered maximum rounds.
No problem.
We can do it tomorrow. మా సంగతులు వచ్చి బతుకుడు అసలు.
उधर एनर्जी बैटिंग के लिए है क्या?
ఇంకొక 100 చేద్దాం సార్.
100 కాదు, मैं 10 बजे तक तैयार हूँ. యా మీరంతా బ్రిలియంట్ స్టూడెంట్స్ కదమ్మా, మీరు బ్రిలియంట్ స్టూడెంట్స్ आर अटेंडिंग मीन्स ब्रिलियंट टीचर शुड. हम रोज 6 महीने से रोज टीचिंग कर रहे हैं विदाउट ब्रेक. दिस इज द टाइम ऑफ कंसोलिडेशन ऑफ ऑल नॉलेज सो दैट आई विल बी अवेलेबल फॉर नेक्स्ट बैच. हाँ फटाफट बोलो. मल्टी यूनिट स्मूथ मसल, वेयर इज इट प्रेजेंट? कामिनी से सर 10 मिनट ब्रेक ले लो, ले लेंगे और एक 10 लेके 10 मोर क्वेश्चंस के बाद अभी शुरू किया ना. बोलो. ब्लड वेसल आइरिस डक्टस डिफरेंस में मल्टी यूनिट रहता है, इसमें सिंगल यूनिट रहता है. सिंगल यूनिट स्मूथ मसल. मर्फी साई is seen in. Very good. You are my emergency girl. Very good. It's a small hole at the distal end of endotracheal tube which is muscle attached to the lateral surface of greater trochanter. Try करो. Gluteus medius. Myelination peripheral nervous system is by Schwann cell. Narrowest part of nasal cavity is inferior turbinate. Narrowest part of ureter is
Just try to
that you pin in that. Beautiful. Vesicoureteric junction. Now Diksha is atom bomb. Nerve entering inguinal canal through deep inguinal ring is. Hey. हाँ? बेट कर रहे हैं बढ़िया. जेनिटल ब्रांच ऑफ Genitofemoral. Nerve include in macroburst maneuver is papa. Macroburst में क्या करते हैं आप?
Push the thigh over the
Yeah,
femoral.
that's good. Femoral nerve. Macrobird is used to facilitate the delivery of the fetus in case of shoulder dystocia. It involves flexing the mother's thigh, which can compress the femoral nerve. Nerve running along with the profunda brachia in spinal group. Chiller question.
In the spinal group is
Radial.
radial.
And what is the supinator muscle supplied by? Supination ఉంటే కదప్పా. నేను ఎన్నిసార్లు చెప్పిన రేడియల్ నర్వ్.
అదే posterior cutaneous.
Cutaneous. इगो supinator is by radial nerve. Okay. आप जरा elbow को flex करो. अभी supination करो. करो. Which muscle is getting? ऐसे लगा के करो यार. You will feel which muscle you are feeling? ఇట్లా పెట్టుకో, ఇట్లా పట్టుకున్నాను, ఇట్లా ఇట్లా పట్టుకో. यहाँ पकड़ के Hare Ram, Hare Krishna. So when you are doing supination, what is contracting in elbow flexion? Biceps. Biceps is supplied by musculocutaneous. So biceps is supplied by musculocutaneous, and it is the main supinator whenever you are flexing the elbow. But if you are flexing the extending the elbow, it is the supinator which is the main supinator, which is supplied by radial nerve. So what is the typical story I told you earlier also? A carpenter, fully drunk, fell down. Next day morning when he went to carpentry, he is unable to screw the door with his elbow extended. He is unable to screw. For screwing the door, what do you require? Screwing, unscrewing the thing, supination. But when he flexed the elbow, he is able to do his work. What is the reason? Radial nerve. Radial nerve is injured whenever there is any fracture in shaft of humerus. One of the favorite clinical vignette in both USMLE and also in NEETPG. Is everybody clear? Summarize. Main supinator when the elbow flexed. Biceps is supplied by musculocutaneous. Main supinator when the elbow is extended. Supinator. Supinator is supplied by Khatam. Kush hua Mogambo. So next doctor. Nerve running along with profunda brachii. But see, so many times the examiner asked. Nerve supply of cervical esophagus. Right recurrent, left recurrent, and also vagus. Nerve supply of the larynx above the level of the vocal cord. Which branch? Internal branch of superior laryngeal nerve. Nerve supply of stapedius. जरा भरत को कोई हिलाओ यार. Not called tympani. Nerve stapedius. Facial nerve, కానీ called tympani కాదు. After 30 years also, I'll remember this if Bharat comes back. And every time I teach called tympani, for next 30 generations, I keep talking about Bharat. And also, what eye? No, at the end, what eye? Endotracheal tube के end में. जब भी मर्फी साई का बात होगा, next 30 years, Diksha's granddaughter will come for coaching after a few years. Your nanny was So, Nani. Your Nani was so wonderful. She knows Murphy's Law, man. She knows the business. And Mithina's granddaughter, when she comes, I'll tell, Marcus gun pupil. Oh my God. Immediately Mithina gets up with full energy. ये तो बीच में टपक है हाँ? तब टपा के निकलेगा दिनिशा से मालूम नहीं. Good. So, nerve supply of extraocular is all the three. Chiller question. You remember, no? Oh, Amma. What is the rule of Rad-Sin? Extraocular muscles primary action. All superiors are intorters. So that means superior rectus, superior oblique. Both of them do intorsion. Rad means all recti are adductors. That is superior rectus, inferior rectus. Both of them are adductors. Understand? So don't forget the rule of Sinrad in the tomorrow's exam. Nerve which loops around submandibular duct is lingual. Anyway, लिख लो. Lingual nerve पढ़ना है बराबर. Auriculo temporal nerve के बारे में पढ़ना है बराबर. Definitely आने वाला है NEETPG 2023. Neurovascular bundle of anterior compartment of leg passes between the tendons of EHL and EDL. External hallucis is longest and Tom, Dick and nervous Harry. మరి ఇది ఎక్కడమ్మా ఏ హాలిసిస్ కదా మళ్ళీ చెప్పండి టామ్ డిక్ అండ్ నర్వస్ హ్యారీ దిస్ ఇస్ tibialis anterior. D is EDL, H is EHL. ये दोनों के बीच में you have the artery and nerve. That is what he is asking, whether you know Tom, Dick and nervous Harry. You got the idea what I am talking?
Medial side.
Footla. Medial side low. Neurovascular plane in anteroabdominal wall is located between oblique and transverse abdominis. Normal cerebral blood flow. Yesterday only we discussed. But so many times asked, आपके दिमाग में कितना खून बहता है? Normal time taken for the scar formation. You are famous now.
3 weeks.
4 weeks.
4 weeks. Collagen is 3 weeks.
In the mundu 2 weeks munde.
See, collagen is to 3 weeks.
End of second week.
Not a sign of stellate ganglion block. Stellate is sympathetic ganglion. అమ్మా హార్నర్స్ లో ఏమేమి ఉంటుంది అబ్బా? టోసిస్, మియోసిస్, ఎనాఫ్థాల్మోస్ ఉంటుంది. సో stellate ganglion block is also sympathetic ganglion block like Horner. So what will it not have? Exo will not be there, enophthalmos will be there. Not attached on medial border of scapula is serratus anterior levator scapular, rhomboid major are all attached. Teres is not attached to the middle border of the scapula. About the facial vein, Largest vein of the face formed from angular vein. It has no valves. It drains into internal jugular. IVC drains into?
So, ascites drains into superior vena cava.
Amma, pole.
IVC drains into right ventricle.
Okay.
18. So we'll take a break. Sir,
In breakup? Okay. 48 ऑनलाइन स्टूडेंट्स, हम बहुत खुश हैं. आप छोड़ना नहीं. So my request to 49 students is, it's only 5-minute coffee break. हम रात 10 बजे तक रोज 1000 क्वेश्चंस खत्म करके जाएंगे घर को. Only take the break and come back. Please come back. Bring your other friends also. All right. So it is a 5-minute coffee break. Hey, coffee break means coffee break. Seriously, 10 मिनट में अगर आप नहीं आए तो मैं शुरू कर देता हूँ.
Remember Venetia, she gave pneumonic for hypoxia and all that.
Many times I'll remember Venetia.
अभी याद नहीं आया.
Good, not bad. We finished 173 questions. In 2 घंटे के अंदर. So our speed is 100 questions per hour. इनका फास्ट बोलो. Good. సురేష్ ఇండివిజువల్ గ్రూప్స్లో ఒకటి పోస్ట్ అట్లా నా లిస్ట్ రెడీ అయినాక పీడిఎఫ్ నాకు కొంచెం చెప్పండి, నాకు పోస్ట్ చేయండి, ఒకసారి చెక్ చేసి ఓకే అంటే దెన్ యూ కెన్. సురేష్ all righty, let us restart the game, Dr. Kamini Sakore and Shivanarayan, Meghavi Patel, and many more who are all online. Please drop a line in all your WhatsApp groups that the live class has restarted. Next 200 questions must give us a real kick. Huh? Yeah. Huh?
Like you said, knowledge is free.
Correct. Then only when we share the knowledge to the others, then only the real sharpness comes out. So, doctor, inferior extensor retinaculum. It is Y-shaped. Inferior slip is attached to the deep fascia of the sole.
Sir, I have a doubt. It could be reaching a question, it could be even not just
Better. Just have this thing. Yeah. So, once more to all our online students, I want to tell you, another 10 minutes I will be sharing a PDF to all of you. 1131 topics. Each subject 50 to 60 topics are there. They are all arranged in the descending order of the priority in the frequency at which the questions came previous years. Right? So, at least out of the 60 topics in every subject, आप top 30 topics को पढ़ने की कोशिश करो, उसमें से वो 10 or 5 questions आ जाएगा आराम से. It is a descending order. For example, microbiology. Highest number of questions came in streptococci, chlamydia, HIV, Like that, you need to take the descending order in this last movement of preparation. और 10 मिनट में मैं आपको पूरे व्हाट्सएप ग्रुप में जहां भी आप हैं वहां शेयर करूंगा. और अगर कोई व्हाट्सएप ग्रुप में नहीं ज्वाइन हुआ तो देन प्लीज ज्वाइन द व्हाट्सएप स्टडी ग्रुप. राइट, सो दिस इज द व्हाट्सएप स्टडी ग्रुप. पूरा मैं 1151 हाईएस्ट टॉपिक का लिस्ट देता हूं डिसेंडिंग ऑर्डर में, मगर आप 1151 पढ़ने का जरूरत कुछ भी नहीं है. खाली आप एवरी सब्जेक्ट में टॉप 30 टॉपिक्स पढ़ो डिसेंडिंग ऑर्डर में. सो डॉक्टर, नंबर ऑफ लोब्स इन द ब्रेस्ट, लॉब्यूलाई हो गया ना,
4 quarters.
and 15 lobes.
Okay, 10 to 15 lobules, also
15 lobes. Number of muscles in middle ear, 2. Stapedius and tensor tympani. Number of stem villi, a term in human placenta, 60 villi. Number of vertebrae is usually constant in सर्वाइकल. नेक में गड़बड़ नहीं हो सकता, कहीं भी और हो सकता. न्यूट्रिएंट आर्टरी रन्स टुवर्ड अवेना, towards metaphysis. Metaphysis is the most vascular part. Most vascular part is what you need to remember, doctor. Good. Now, have you sent a PDF? So, then doctor, obtuse angle of the mandible is seen in infancy. Obtuse angle of mandible is normal feature in infancy and childhood. Oculomotor nerve supplies all these except, come on, lateral ductus. Killer question. 2012 का NEETPG का question. Olecranon process of the ulna helps trochlear notch. Very good. Natural organic search हो रहे हैं brain में. Depolarizing muscle relaxation. If ChatGPT can have intelligence, हमको भी हो जाता. 10,000 क्वेश्चंस आप खत्म करने के बाद मेरे साथ ऑटोमेटिकली आंसर सही उत्तर निकलेगा पुत्र. Then depolarizing muscle relaxing, succinctonium. Optic cup is derived from neural ectoderm. Very good. Organ of Corti is situated in basilar membrane. Ossicles of middle area are responsible for reduction of impedance to sound transmission. Huh? See, they reduce the impedance of sound transmission, thus increasing the efficiency of sound transmission. The footplate diameter versus that of the handle. It's not for amplification. What are you talking? Passage के लिए of the sound, conduction, deafness. What part will amplify sound? बताओ. No, your tensor tympani and what is that called? See, if ossicles would not have been there, what would have been the situation? To the inner ear, to the outer ear, your sound need to travel in empty space. Understand? That is the reason ossicular chain fixation, otosclerosis and all, will lead to the development of deafness. It is not for amplification, it is for...
Every number only, sir.
Huh?
Bones in the middle ear amplify. Bones in the middle ear amplify ossicles.
Anyway,
Amplify sound vibration.
but definitely it reduces the impedance of sound transmission, one bone attached to the other.
Sir, it is only stapedius. Need to
Okay, anyway, frame of question toda. Ossification center of scaphoid appears. Chepu, ఏమంటాను?
Scaphoid years, sir. 2 to 4 years.
4 to 6 years. She only said no, 4 के बाद आएगा scaphoid.
She shared a picture of the group.
Something or other you do here, you do some magic because ossification center इतने बार पूछ रहे ना, इसलिए. Good, Kamini. Keep punching your answers, doctor. That is the way you can keep the chain moving. Now, otosclerosis affects ఇంకొక 2 గ్రూప్స్ ఉన్నాయి నా దాంట్లో కూడా వేయండి మిమ్మల్ని యాడ్ చేశాను. అది 2 గ్రూప్స్. which one? Stapedectomy and all that we do know. Ovarian artery is a branch of abdominal part. Once more, testicular artery, ovarian artery, aorta నుంచి రావా? డైరెక్ట్ గా వస్తాయి కదా. అరే రామా, at what level ovarian and testicular artery arise from aorta also is a favorite MCQ. Anyway, all arteries, external iliac artery, internal iliac artery, वो तो रखना है आप लिस्ट.
That is what kicks us out.
Good realization. Pain receptors are free nerve endings. Masonets are rapidly adapting mechanoreceptors. Pacinian cups are rapidly adapting mechanoreceptors. Merkels are slow adapting mechanoreceptors. None of them will appreciate pain. Pancreas divisum indicates failure of fusion of the ventral and dorsal pancreatic buds. Paranasal sinus present at birth is ethmoid and maxillary. Parasympathetic supply to lacrimal glands. So, coda tempori taste. What is your answer? Good. It carries the parasympathetic fibers to lacrimal gland. Lesser petrosal nerve carries parasympathetic fibers to the otic ganglion. Chorda tympani carry parasympathetic fibers to submandibular sublingual glands. Lingual nerve carry parasympathetic fibers to submandibular sublingual. Parathyroid is implanted after you do parathyroidectomy. Brachyradialis. Few things, we fall in love with them. Parotid duct opens opposite to? Very good. Second upper. Upper second molar. Part of sympathetic system would secrete the chemical transmitters. Adrenal medulla. It secretes catecholamines. Pasa once ridge is formed by palatopharyngeus. It is the contraction of the palatopharyngeus muscle. Palatoglossus is a muscle of soft palate. Superior constrictor is a muscle of pharynx. Salpingopharyngeus is the muscle of pharynx. Pectus excavatum is protrusion or depression?
Protrusion is pectus cavatum.
Please don't depress me by saying cave. मेरा शाउटिंग सुन के लोग सोच रहे हैं कि मैं कोई स्ट्रीट हॉकर के जैसे दिख रहा हूं. हाँ बोलो अम्मा, pelvic kidneys are due to all except why P53 बकवास ऑप्शन. Inability to ascend. Fusion of lower poles being blocked by the branches of aorta. Pelvic pain is mediated by autonomic nerves. Pharyngeal muscles are derived from which pharyngeal arch? థర్డ్ కి ఏముంటుందమ్మా ఫెరింజియల్ ఆర్చెస్ లో? గ్లాసో ఫెరింజియల్ కదప్పా. సెకండ్ కి ఏంటప్పా? ఫేషియల్ కదా. ఈచ్ ఆఫ్ ద ఫెరింజియల్ ఆర్చెస్, what is their nerve, what are the muscles supplied, everything you should read. अब देखो एनाटॉमी का लिस्ट दिया मैंने. No, टॉपिक लिस्ट చూడండి. What is the highest number of questions came from? Huh? Pharyngeal arches compulsory, 16th topic in the list I gave. How many are there in that list? 1151 high yield topic list. Anatomy में 60 है. Simple. Just read that 1150 topics, more than enough. So online students also, I am going to send you that 1150 high yield topics list.
Sir, 25 histology and SLC.
Huh?
25 in anatomy, sir. Histology and repair.
Histology.
Histology is broad way. Histology is so.
Epithelial లేదా? Epithelial types ఉందా పోనీ? అంటే కచరా హిస్టాలజీ లెఫ్ట్ ఓవర్ ఆఫ్టర్ ఆల్ హిస్టాలజీ ఓవర్ అబౌవ్. छोटे मोटे histology. By the time you read the top 20 topics in that 60 only, पूरा orgasm आ जाएगा. You are ready for examiner to hit the examiner. Don't worry, online classmates, I am going to send you the 1151 high yield topic list. Pisiform articulates with triquetral. अब बाहर गुर्जबेट्टो P इतना तक क्यों आ?
She looks too pretty.
Oh. And what is largest? Scaphoid is the largest carpal. Trapezium articulates with first metacarpal. Lunate articulates with radius and scaphoid. Position of testis at 24 to 28 intrauterine life is? So when will inguinal descent will begin? It is at the deep inguinal ring. Postganglionic parasympathetic fibers are what time? I mean, A alpha, A beta, A gamma. Postganglionic parasympathetic are C. Student, sorry?
C is low pain fibers.
C is unmyelinated fiber. No, preganglionic B, postganglionic C kada. అమ్మా ఎట్లనయ్యా ఎట్లా బెదిరిస్తావు? మళ్ళా ఏం చదవాలి? नर्व फाइबर क्लासिफिकेशन को जय बोलो महाराज गणपति महाराज की, एक बार देखो बेटा, नर्व फाइबर क्लासिफिकेशन फिजियोलॉजी में उच्च लिस्ट में है, वो व्हाट नंबर में है नर्व फाइबर क्लासिफिकेशन? नर्व फाइबर क्लासिफिकेशन
Nerve conduction is such a
Huh?
nerve conduction is such a nerve conduction is such a 9. Nerve fiber classification 29.
29th topic in the list I have given you is nerve fiber classification. A list ready అయిందన్న PDF పంపియండి, పంపించి చెప్పండి. We will share it to everybody. Mahalakshmi is asking, sir, when we get ophthalmology rapid revision? Mahalakshmi, तो
नहीं होगा सर, नहीं होगा.
खत्म हो गया ना ophthalmology? కాలేదా? మొన్ననే కదా అయిపోయింది. రెటినైటిస్ పిగ్మెంటోసా सब कुछ हम खत्म किया. महालक्ष्मी posterior cardinal vein develops from common iliac vein. Posterior cardinal vein develops into common iliac vein. Superior vena cava is large vein, right? And once more, वो venous system का एक बार review करो. Posterior epistaxis Woodruff. Posterior relation of hilum of the lung is Van.
Okay, yeah, Vegas. Okay.
Nerve.
Posterior relation.
Arch is
Acha,
superior. Descending is
BA. Okay. Nerve అంటే most anterior vein ఉందా?
anteriorly phrenic nerve, posteriorly vagus nerve. and-
Posterior surface of the heart is formed by.
Superior.
Come on.
Posterior surface of the heart.
Left atrium.
Left atrium.
Left atrium. Posterior to sternum is immediately
Right ventricle.
right ventricle. So whenever sternal injury is there, right ventricle is most vulnerable. Preauricular circus is part of difference between male female pelvis.
Pelvis.
What is the difference? Who will have a prominent preauricular sulcus? Male and female male. Auricular and eauricular అనుకుంటున్నావా బంగారు బాబు? Then prolonged surgery time of vaginal hysterectomy would lead to damage to pudendal ఏందమ్మా?
Vaginal hysterectomy కాదు. Sir, vaginal hysterectomy.
Which is the motor nerve that supplies the lower limb. What is that called as? Peroneal nerve injury is common in prolonged hysterectomies. In the way you position the patient.
Yeah, they
Ah. Huh?
lithotomy.
Lithotomy में. Exactly. Prostate analog in female is? Come on. Skin. Protrusion of tongue is not possible. Who causes amma? మళ్ళీ రాసుకోండి. Lateral pterygoid, medial pterygoid. What is their nerve supply? What is their function? In the tongue movements. Definitely एक MCQ आएगा. Try करो. और extend करो. The guy sitting opposite will get different plans. Hey, don't do that. Then genioglossus. Styloglossus is for retracting.
That's what keeps the rest.
Styloid पीछे है ना, retract करेगा.
Sorry, 12th nerve.
जर्नी आगे बैठे ना,
12th nerve.
protract करेगा.
Same side deviation ఉంటుంది కదా sir.
Huh?
12th nerve damage, the tongue is protected to the same side and ఉంటుంది కదా sir.
టంగ్ ఉంటుంది కదా, టంగ్కి వెనకాల స్టైలో హయాయిడ్ అంటే వెనక్కి గుంజుతుంది, జీన్ని హయాయిడ్ ముందు గుంజుతుంది, హైయో గ్లయాయిడ్ హై అంటది కింద పోతుంది,
Side to side is this.
పెలెటో పై గుంజుతుంది, పెలెట్ పైన ఉంటుంది కదా టంగ్ పైన, పెలెటో గ్లాసెస్ ఎలివేట్స్, హయో గ్లాసెస్ డిప్రెసెస్, స్టైలో గ్లాసెస్ రిట్రాక్ట్స్, జినియో గ్లాసెస్ ప్రొట్రూట్స్.
దీంట్లో అన్నింటిలో ఏదో మజిల్ రెస్పిరేషన్ జీనియో ప్రాసెస్
Pubic symphysis is which type of joint?
Comphysis.
Fibrous joints.
Secondary na primary ఆ?
Comphysis, then
ఏం కాంఫోసిస్? కాంఫోసిస్ అంటే ఇక్కడ ఉంటుంది ఫింగర్లా. అయ్యో, ప్లీజ్ స్టడీ జాయింట్ టైప్స్. ఓ మేడం, joint types is one favorite topic in NEETPG. Every time you go to exam, which is saddle joint, ball and socket joint, what is gamphosis, what is primary cartilaginous, everything. Will you promise me? एनाटॉमी का लिस्ट देखो, मैं जो दिया ना एनाटॉमी में जॉइंट टाइप्स का नंबर क्या है प्रायोरिटी लिस्ट में? जॉइंट टाइप्स 21st topic in descending order, right? Barabar. Pudendal nerve block involved. Pudendal nerve block involved. S234. L1 to L3 are lumbar plexus. Pyramidalis is supplied by subcostal nerve. అదే ఎక్కడ ఉంటుంది? కోస్టల్ కింద. కోస్టల్ ఆంధ్ర ఉందిగా, దాని కింద. Which is the branch of anterior primary ramus of the 12th thoracic nerve. Directly 12th thoracic T12 ఉంటుంది కదప్పా, దాని యాంటీరియర్ ప్రైమరీ రామస్ ఉంటుంది కదా, దాంట్లో నుంచి సబ్ కాస్టల్ నర్వ్ తయారయ్యి అది పిరమిడాలిస్ సప్లై చేస్తుంది. ముందు పిరమిడాలిస్ ఎక్కడ ఉంటుంది? See, how do you get seat in see, Vinisha, everybody will ask a question. How much anatomy we should know to get seat in NEETPG? Answer is simple. You should know more than your sister who did BTech. If you know that much anatomy, you will get seat. Yesterday Kaushik said, no, when it comes to anatomy, sir, मैं और मेरे BTech brother के बीच में क्या कुछ भी फर्क नहीं है. So quadrangular septum is seen in which? Nose. Nasal septum, how is it formed? What bones form nasal septum? Radial bursa. In synovial sheath, it covers which tendon? FPL, flexor pollicis longus. भाई पॉलिक्स बोले तो तंब कहाँ होता? रेडियल होता. बस उसमें क्या है? रेडियो फ्रीक्वेंसी एब्लेशन इज derived from alternating current. ये तो टू मच है, हमको फिजिक्स नहीं आता ना, इसलिए यहाँ है. Remnant of notochord is nucleus pulposus. Renal papilla opens into minor calyx. Respiratory bronchioles are formed from terminal bronchioles. Right border of the heart is formed by right heart में क्या होगा? Right atrium. Right hepatic vein drains into which segment? Mala covenard segment. Sure shot MCQ. एनाटॉमी क्लासिफिकेशन में एनाटॉमी टॉपिक्स लिस्ट में देखो कवर्नाड है क्या? Which number? 9th priority topic in the list I gave you. 1151 high yield topics list. वो नहीं पढ़ के गए तो मुश्किल हो जाएगा. रेडी है सुरेश? PDF సురేష్ పంపించో.
Impending doom. If we need other questions, I will. In part of it,
Super. Share it.
I like that. I should take care of it.
Split personalities.
అన్ని గ్రూపులో షేర్ చేయండి. Very good. Just now I shared in all the WhatsApp groups, Doctor. 1151 yield topics in descending order, from which 200 MCQs come. So if you have not yet joined our WhatsApp study group, please join in this group link, and you will receive the PDF of 1151. But every subject has 60 to 70 topics. Don't read all also. At least half of them you read. हम धन्य हो जाएंगे. All right, doc. Right hepatic vein drains into the right lobe of the liver and segment 7. Segment 1 drains into left hepatic vein. Segment 2 drains into right hepatic vein. 4 drains into right hepatic vein. 7 drains into right hepatic vein. Right ovarian artery is a branch of abdominal aorta. Right suprarenal vein drains into directly IVC. Left drains into renal vein. Very good. Rigor mortis in fetus at birth can be seen in dead bone. Rhizorius is a muscle of facial expression. Rolled up momentum is seen in case of peritoneal TB. Root value of thoracodorsal nerve 678. Root value, once more asked 2 times. Rowier nodes are situated in pharynx के पीछे क्या है? Rowier node is located in the retropharyngeal space. Right? Rule of 9 in Burns is used to denote percentage of the total body surface area. Sacral promontory is the landmark of termination of presacral nerve, which is a branch of the ventral rami. Always ventral rami or motor, no? Of second and third sacral nerves is called presacral nerve. Sacrotuberous ligament is pierced by perforating cutaneous nerves, which is the branch of posterior femoral cutaneous nerve. Salivary gland is Located in the head and neck and specific. No, I think that's a forget about that question. Sarcoma is
Muscular.
no. This also leave it. It's not a good question.
Sarcoma is a muscular.
I mean that's a bad frame of question. Sputum is present in middle ear. Where? Sputum kaadu sputum. Lateral wall.
अरे ऐसा हाँ lateral
Okay.
lateral wall से क्या होता है
Tegmental is roof.
Sputum is bony plate in the lateral wall of middle ear. Secondary ossification center at the lower end of the femur is present.
Present at birth.
Good.
Boarding a
Sequestrum is what?
piece of dead.
Piece of dead bone surrounded by infected tissue. Shortest acting local anesthetic.
Locate.
Procaine.
Sir,
Shortest transverse diameter is
shortest
bimastoid. Mastoid both nazdik hai na. Height of injection gluteus this minimum. IM injection कहाँ देते? We'll ask Vinisha. पता बोलो अरे IM injection कैसे देते हैं नहीं मालूम है तो हाँ गुलबर्गा मेडिकल कॉलेज है
Sir, superior. Don't blame the colleges.
skeletal derivative of first arch is
Maxilla.
step is second appa
Second.
maxilla.
Maxilla.
The first arch gives to maxilla and the mandible, which form the upper and lower jaw. Step is
Second.
is the second. Skin on the hypothenor eminence is supplied by
Median.
idi thinner, idi hypothenor.
Median.
Hypothenor ante little finger kada, medial aspect. Idi thinner. Hey, maybe na iro like delva thinner, hypothenor ante oh. Hypotheru. Slowest blood flow is seen in come on, capillaries. इसलिए वहां ऑक्सीजन एक्सचेंज होता है ना only 0.75 seconds it will spend na. Somatic efferent of which arise in medulla.
Somatic efferent.
మళ్ళా ఇంకొకటి ఓ పెద్ద బోర్ టాపిక్ వాట్ ఆర్ ఎస్విఈ వాట్ ఈస్ ఎస్విఏ వాట్ ఈస్ జిఎస్ఈ వాట్ ఈస్ జిఎస్ఏ general somatic afferent, general somatic efferent, special somatic afferent. Sautara idi? Each of the cranial nerve is divided into the kind of the branches it delivers into SVE, SVA, GSC, GSA. General somatic afferent, general somatic efferent, special somatic afferent, special somatic efferent, special visceral efferent, special visceral afferent. Each cranial nerve में क्या क्या रहता मगर ये आंसर करो पहला मेडुला అంటే hypoglossal third fourth mid brain 5 6 7 pons 8 9 everything else in the medulla. Somatic then space of dishy liver. Spermatogenesis, where does it happen? Seminiferous tubules. Spermiogenesis means what? Mio.
Formation of spermatozoa from spermatids.
Formation of nia from spermatids to meet mio. Spermio. And once more, favorite question. लिख लो. Spermatogenesis में what is haploid until which stage it is diploid? वो जरा गर्मागरम पढ़ना पड़ता. And the entire process.
Oogenesis is also important.
Oogenesis ovulation तो bomb like topic na. Without that there is no question paper. Spigelian hernia is to the lateral border of rectus abdominis. Very good. Spinal cord develops from neural tube. Spleniculi are seen commonly in hilum. Kidney.
You like that, sir?
ये किडनी कौन बोला? ये स्प्लीन होता है अम्मा.
అది స్ప్లిట్ లాగా లేదు.
ఎందుకు లేదు? నాచెస్ కూడా ఉన్నాయి. మనం ఎప్పుడో స్ప్లీన్ చూస్తేగా. स्पेनिकुलई इन हाइलम. स्टेपिडियस पुल स्टेपिस इन which direction? एटलीस्ट ये बताओ और आपका क्वार्टर टिम्पनी कैंसिल करेंगे. गुंजवे में नत्ता कुतरा. Stereocilia are found in Hylessa. स्पर्म को कौन हाइलेसा करेगा? स्टाइलोकॉन्ड्रल जंक्शन इज మళ్ళీ ఇదొకటి. అక్కడ ప్యూబిక్ సింపసిస్ సెకండరీ, ఇదేంది చెప్పుర్రి అంటే అది సెకండరీ కాబట్టి ఇది ప్రైమరీ.
మీరే టూ ఇచ్చారు కదా.
మరి వేసుకోండి. ఇక స్టర్నోక్లిడోమాస్టోయిడ్ ఈజ్ ఎగ్జామిన్డ్ బై Yeah. What is your answer, doctor? Turning the head towards the opposite side. Stimulation of extralaryngeal, auditory canal lead to cough. What is it due to? ఇగోర్రి 3 రాసుకోండి. 3 పాయింట్లు రాసుకోండి. జాకబ్సన్ నర్వ్, అర్నాల్డ్ నర్వ్, विडियन नर्व. ये मूड ऑलरेडी वी डिस्कस्ड इन. मैं और एक बार बोले तो मजा नहीं है, शोभा नहीं देता मुझे. ऑरिकुलर ब्रांच ऑफ द वेगस. स्टमक is supplied by all of them. Obviously, no. So once more, लिख लो. Blood supply of stomach is a favorite question. Stroma of the cornea develops from నిన్నే చెప్పుకుందాంగా. స్ట్రోమాలో which part is cornea layers है ना. लेयर्स में से क्या लेयर कहां से आएगा? हमने ऑफ्थल्मोलॉजी में पढ़ के भूल गया. स्ट्रक्चर क्रॉसिंग डोर्सल सरफेस ऑफ ischial spine. Pudendal, interpudendal, nerve to obturator internus, everything cross but not. Obturator is that cross the dorsal. एक बार देखना पड़ता है. स्ट्रक्चर डेवलपिंग फ्रॉम मुलेरियन डक्ट इज అన్ని ఇవన్నీ మొగోలవే ఉన్నాయి. జెనైటో యూరినరీ సిస్టమ్. అచ్చా, something in prostate left over which is Mullerian derivative is prostatic utricle.
This is usually located in the wall of bladder. Wall of bladder located in the.
Only Mullerian is for females. But prostate में थोड़ा घर का utricle दाल बराबर. Mullerian duct. little utricle. Males में Mullerian, utricle बराबर. Structure immediately posterior to pancreatic head is already pancreas is retroperitoneal. उसके posteriorly क्या रहता? Right renal vein. Kidney is intraperitoneal or extraperitoneal? Retroperitoneal. Huh? हाँ. Spleen. Right renal vein lies immediately posterior to pancreatic head. Right? Structure of our bicipital eponeurosis in cubital fossa. Already I told. మొన్ననే అయింది ఇది. ఒకసారి మళ్ళీ ఇది చూడండి. Just check this. Because bicipital eponeurosis is crossed by radial nerve and brachial artery and veins. And veins. So all of the three. Anyway, to take out the venous blood, you don't go behind the brachial artery. I mean, bicipital eponeurosis now. Structure passing deep to flexor retinaculum. Foot में. Posterior tibial. Once more, what do you need to read?
Extensor and flexor.
Cubital fossa. Cubital fossa, what are the boundaries? Contents, everything. Then flexor retinaculum. Underneath क्या चलेगा? ये दोनों favorite topics of examiner हैं. Structure which lies outside the femoral sheath. Femoral nerve.
Some nerve lies outside.
Structures derived from neural crest are
Adrenal.
ఆరణంగా అర్థమైపోయింది కదా. ఇట్లాంటి క్వశ్చన్లు ఎప్పుడు 2012 में आता, आजकल नहीं आ रहे. फिर भी ये knowledge base is important. Neural crest derivatives high yield topic. Structure pierced by parotid gland. Buccal pad fat, buccinator, buccopharyngeal fascia. They're all pierced by parotid. Styloid is derived from S for second. S for styloid.
SSS.
Submandibular lymph nodes drain which areas except central part of lower lip, medial half of the eyelids, medial part of the cheek, central part of the forehead. Now question comes. Central part of the lower lip, the medial half of the eyelids is drained by the submandibular lymph node. ఇంకోసారి రివిజన్ చేయండి. లిప్ కా lymph drainage. Submandibular lymph nodes are classified as, once more, neck में lymph nodes का levels of neck lymph node is a favorite topic of the examiner. They comes under level 1B. Superficial epigastric artery is the branch of femoral artery. Internal pudendal is the branch of internal iliac. External pudendal is the branch of the femoral artery. Exhausted? Superior pancreaticoduodenal artery is the branch of gastroduodenal artery. Superior vena cava develops from SVC. Right anterior cardinal vein. Once more I told you, no? How is IVC? SVC. What are the embryonic structures from where they have been developed? Is the favorite area of the examiner. It's good know you are knowing what to quickly read and improve yourself. खाली पढ़ना ही बचे हुए हैं. Superior wall of middle ear is formed by tegment tympani. That's how the spread to the middle ear is the most common cause for the temporal lobe abscess in the brain. The moment tegment tympani is damaged. Once more, what is the favorite topic in the examiner question bank? Middle ear का roof, floor, walls of middle ear is the favorite topic of the examiner. Supraclavicular block is used for arm, forearm and shoulder. इसमें क्या टेंशन नहीं है. Suprarenal gland gets its blood supply from aorta, renal artery and inferior phrenic artery. Adrenal gland, suprarenal means. It is supplied by superior suprarenal artery arising from inferior phrenic artery, by the inferior suprarenal artery which arises from abdominal aorta. So, కాబట్టి ఏం రాసుకుంటారు? Adrenal blood supply.
Three parts, sir. Okay, తర్వాత middle part inferior, superior part lower. And it
ఉంది.
three parts, some different supply.
కానీ చదివి చెప్పండి రేపు నాకు. Surgical markings for the finding of facial nerve is tympano is the most reliable landmark for locating the tympanomastoid. यहाँ से निकलता ना. Sweat gland near the lid margins is, this I told other day, ophthalmology review में. Lot of students को मालूम नहीं होता है मोल क्या होता है, क्रॉस क्या होता है, जिस्ट क्या होता है, मिबोमियन क्या होता है. Lid margins.
Cross or Z, sir.
Meibomian, internal hordeolum. Sebaceous glands at the lid margins, they secrete oily substance.
So you ask sweat glands.
Gist is base of eyelashes. Mole is sweat glands located in.
Sweat glands, sir.
Huh?
Question was a sweat gland, sir.
Sweat gland.
Meibomian is sebaceous, sir.
Hmm?
Then mole is the answer. Meibomian is sebaceous, sir. We are
అసలు మోల్ ఇక్కడ ఉండనే ఉండదప్పా. It serves both.
అంటే cross కదా, sir. Answer. Cross is nothing but vein and area. Okay.
आप एक काम करो, मिबोमियन ग्लैंड इज द स्वेट ग्लैंड नियर द लिड मार्जिन बोल के मारो, गूगल बोल देगा. Sympathetic supply of the heart is from always thoracodorsal. Thoracolumbar is sympathetic. Craniosacral is parasympathetic. So thoracic sympathetic fibers supply the heart. So body part क्या है? Until you know that heart is in thorax. Tail of pancreas develops from dorsal pancreatic duct. Thallus is supplied by
Mole's glands, also known as gland of mole or ciliary gland, is modified epocrine sweat gland that is found on the margin of the eyelid. Mole is the answer, sir. Meibomian is sebaceous, I think.
okay, good point. तो इसका आंसर मोल करो भाई, क्योंकि प्रोफेसर मिथुना अभी बताया. मोल क्या होता है बेटा?
It is the
Modified apocrine
gland
sweat gland
on the lid margin.
along the lid margin, whereas meibomian is sebaceous gland.
All three are there, sir. Meibomian is mole is there. That much I remember. I know that meibomian is not at all because you are sweat. It's sebaceous.
It's okay, you are right, but आप तो इंटरव्यू दे रहे हैं.
Mole is sir, meibomian.
They
And also, wherever you say.
thallus is supplied by all of them. Dorsal pedis, anterior tibial and posterior tibial. Teres minor is supplied by
Axillary. Axillary is protector cuff. Axillary. We can't go wrong.
good. Teres minor is supplied by axillary nerve. Suprascapular supplies supraspinatus and infraspinatus. Infrascapular supplies subscapularis. Thoracodorsal supplies latissimus dorsi. Testis develops a deep inguinal ring up to come on, up to 9 months. Sorry, up to 7 months. That's the reason any preterm baby will be a lot of times born with cryptorchidism, because testicular still remained at deep inguinal ring. तो इसका मतलब क्या है? Compulsory testicular descent is the favorite topic of the examiner. Third ventricle is the cavity in which part of the brain, doctor?
This is called
Diencephalon, which is between Telen and Misen.
అది కూడా చదవాలి సార్ ఎందుకంటే బోర్డ్ ప్రాసెస్ అసెంబ్లీ అట్లా అడుగుతున్నాను
Time దొరికితే చూడరా. Ventricles చదవాలి. Artery which leads to bleeding in Woodruff is Woodruff posterior, you know. Absolutely. आपका तो वो ज्ञान आ गया, आर्टिफिशियल इंटेलिजेंस है. Mithuna, distance by which two stimuli must be separated to be considered as two separate stimuli is greatest in Om Namaha.
Why did you put in your hand?
You thought lips, sir? Is it back of scapula is most sensitive for touch perception? Huh? Lips are least sensitive area for touch perception. ఒకసారి చూడండి ఇది. Distance by which two must be separated is greatest. Okay.
What is the least?
Means you can give French kiss only on the lips but not in the back. See, two stimuli, if they are too closely spaced, they can't be perceived. Whereas lip is so sensitive that it can perceive a densely, closely packed stimuli. Esophagus is located in all the following locations except, narrowed. Where is it narrowed? Esophageal constrictions. Located కాదు, constricted. Diaphragmatic aperture, crossing of the arch of aorta and crossing of the left bronchus. What is the commonest site of venous ulcer? Come on, Diksha.
Median size. Median.
Lower third of the leg and ankle along the goiter area, which is middle aspect. Gallstone pain is referred to shoulder by which nerve?
C5.
Obviously, shoulder means phrenic nerve. Phrenic nerve means what? Come on.
C5,
C3, C5. Hard palate contains what? Hard things.
Not very
Keratinized होना है submucosa, minor salivary glands. Internal loss of cervix is 1 centimeter wide. Internal loss. External loss is 1.5 centimeter wide. Endocervical canal is 2 centimeter long. Cervix is approximately 2.5 centimeters long. Junction between retina and ciliary body is, you know this.
parts. No. Urology is choroid ka part. Parts.
Pars anta intermediate kadappa.
Parts plan.
Idi retina ante path piche. Direct, indirect ophthalmoscopy difference ఏంటి? With that, what can you see?
Past private.
Retina and ciliary bodies ora serrata. Most common site of implantation?
Ampulla is most common. Isthmus most common for rupture.
Fundus.
It's
It's not
Fertilization ki no implantation ki teda undi babai. Most common site of origin of diverticulum of pharynx seen in barium swallow. Given below. Oh, below nahi hai. So between middle and inferior constrictor. So that means what is that?
between 3.5
Pharyngeal junction diverticulum.
between long.
Nerve supply of the nail bed of index finger is? Index, median. इसलिए pointing index भी बोलते हैं. Nutrient artery of the femur is? वाह, इట్లా knowledge బయటకు వచ్చేస్తుంది. Smoke. Smoke is nowadays your smoking subject. Long left recurrent nerve because of the persistence of which artery? మీరు ఎట్లా చెప్తున్నారు ఇవన్నీ? ఎక్కడి నుంచి వస్తున్నాయి? కొన్ని ज्ञान भंडार हो जाएगा. Retina is an outgrowth of. ఇవి ఇప్పుడే చెప్పింది కదా. वाह, ज्ञान का स्मोक निकल रहा है. भरत तो डरना नहीं, तुझे सीट मिलेगा क्योंकि तू संत मिथुना सत्संग में हो. संत मिथुना सत्संग. आजकल पूरा स्मोक निकल रहा है, पूरा ज्ञान की स्मोक. Retina is outgrowth of the encephalon. Very good. Shortest, that's what I'm trying to tell you. You don't need to read 100% to clear NEETPG. आप 40% पढ़ो, आप 40% डेप्थ भी पढ़ो, हो जाएगा, सीट आएगा. आप 80% स्कोर मार के निकलोगे. ठीक है? So that's the reason, have that confidence. That is my promise to all of you. Shortest conjugate is obstetric. Once more, from where to where is true, where to where is ops, where to where is diagonal, anatomical, everything you need to be sure. Right? Now, tensile strength of wound retest, that of the tissue by? We'll come back to that, to this.
So that they are asked thrice certain.
Maximum by 6 months. इसमें 6 नहीं है ना? Months.
Sir, 4 months गुరించి మాట్లాడారు. Explanation different, sir.
6 months तक टेंसाइल स्ट्रेंथ हो जाएगा.
Explanation. అక్కడ
అది వదిలేయండి, 6 months గుర్తుపెట్టుకోండి.
ఇది ప్రిటర్స్ కోసం టాపిక్.
wound healing.
ఎందుకంటే 3 times అడిగారు sir. అన్ని రాంగ్ చెప్పారు.
Pathology-లో wound healing. Pathology में wound healing. Maybe in the list I have given, it would have been there. देखो.
అయినా దీంట్లో రాసుకుంటున్నాం కదా sir.
మీరు రాసినా కూడా pathology-లో wound healing లేదా? ఆర్ లేకుంటే సర్జరీలో ఉంటుంది. పెథాలజీలోనే ఉండాలి మరి.
Pathology లేదు sir.
నో ప్రాబ్లం.
ఇక్కడ రాసుకుంటాం sir.
Good doctor. Thoracic duct crosses from the right to left. Right to left. It crosses right to left to drain ultimately into where? at the level of the T5. T5 में बहुत चीजें होते हैं. T5 is a classical landmark for a lot of things anatomically at the level of T5 vertebra.
Surface mark.
13 pair of ribs are seen in డౌన్స్ లా అది ఏం రిబ్ ఉంటుంది సైజ్ ద షేప్ ఆఫ్ ద రిబ్ అయ్యో నేను ఎన్నిసార్లు చెప్పాను డౌన్ సిండ్రోమ్ మే ద రిబ్స్ విల్ బి వాట్ షేప్డ్ देखो एक बार इसमें गूगल करो रिब शेप इन డౌన్స్ ఆల్మోస్ట్ క్వాడ్రాంగులర్ షేప్ లో ఉంటుంది like apes. Rib shape in downs.
13 pairs. ఇక్కడ ఏందో less than 11 ribs is associated with downs.
Lema rib shape in gorilla rib. Abba. Ape rib అంటారు gorilla rib is seen in downs. అది ఎట్లుంటుందంటే యూ కెన్ చెక్ గూగుల్ ఇమేజెస్. అందులో అది ఉంటుంది ఇది ఉంటుందిలేండి. Okay. Next, time interval between somatic and molecular death is 1 to 2 hours. And after you stop breathing, somatic death occur within 5 to 10 minutes. Molecular death will occur 10 to 30 minutes. Tonsillar fossa is bounded anteriorly by palatoglossal fold. Total surface area of respiratory membrane is 100 meters square. Tracheostomy, what is an indication? Foreign body obstruction, obviously. Triangle of Petit is landmark for which block? TAP. It's called TAP block. What is TAP block? What is TAP block? Transabdominal plane block. It's called transabdominal plane block. Tributaries of cavernous sinus include inferior cerebral vein, central vein, and sphenoparietal sinus, not superior cerebral vein. Superior and inferior petrosal sinuses, and it is drained by superior and inferior ophthalmic veins, pterygoid venous plexus, and sphenoparietal sinus. Cavernous sinus is a very, very hot, short topic.
Even sir, things passing through the sinus.
Everything about cavernous sinus. One MCQ आएगा जरूर. Trigonocephaly is due to premature fusion of metopic suture. Different brachycephaly, plagiocephaly, trigonocephaly, all cephalies of the world. About the anatomy of the right ventricle. Tricuspid and pulmonary veins share fibrous continuity. More prominent trabeculation is seen in right ventricle. Crista supraventricularis separate tricuspid and pulmonary valve, and apex is trabeculated. No, अब क्या करना है ना, हार्ट है ना, हार्ट चेम्बर्स है ना, एनाटॉमी में एक बार रिवीजन करो. अंदर क्या क्या होता है, ये क्रिस्टा टर्मिनालिस का मामला क्या है। अभी सेलेक्टिवली सब्जेक्ट को चेस करना बहुत मुश्किल है, अब बहुत आसान है। ये 10 दिन का है भाई, 8 दिन, राइट। I still carry in those days, postcards used to come. My dad wrote a beautiful letter while I was preparing for entrance exam. Still, that card is there with me. I got in second attempt, I didn't get in first attempt. So, my boy, the time looks too long when you just fail the exam, and it looks too short when exam is approaching. But it is the time is time. Time is just relative. Our perception keeps widening and lengthening and shortening. Better you open up your eyes and show me that you are in medical school. So I always keep that whenever too much time pressure is there. हम सोचते हैं कि खाली 8 दिन 9 दिन, there's no need to panic. Time is time. Day pass like anything else. It's only relativity, right? How much you optimize your time, right? In this next 7 8 days, and let me promise you, believe me, you are truly optimizing your every minute of time with me by being part of this discussion. Okay. So now, doctor, anterior intercostal artery. It is the branch of the internal thoracic artery. Superficial epigastric is branch of? ఇప్పుడే విన్నాం కదా.
Superficial epigastric.
అది
Sir, superficial.
కానీ ఒక్కసారి చూడండి, అది నాకు ఇంకా డౌట్ ఉన్నది.
Sir, epigastric.
అదే ఎపిగాస్ట్రియం ఎక్కడ మరి ఇంతకుముందు అబ్జెక్షన్ చెప్పలే. Superficial epigastric artery is branch of common femoral artery. Femoral है. Superficial epigastric artery is the branch of femoral artery.
Superficial is different, superior epigastric.
ఏదో ఒకటి ఎపిగాస్ట్రిక్ ఆర్టరీ థై से एपिगैस्ट्रियम तक आर्टरी चलता है. ओके.
So superior epigastric is internal thoracic.
Superficial epigastric is the branch of femoral, common femoral artery. గుర్తుంటుందా? చూసారా ఎంత నేర్చుకుంటున్నారు ఇవాళ? అబ్బబ్బబ్బో, too much gyan. So I like to ask the online students, Shweta and everybody, are we going too slow or is the speed okay? So come on, doctor. What about brachial cyst? Mostly arise from second branchial system say. Cardiac muscle, large central, huh?
Large central nucleus.
Oh, I'm sorry. One minute. Okay. About cardiac muscle, spindle-shaped cells with a single large centrally located nucleus. About the clavicle, there is no medullary cavity. The only long bone with no medullary cavity which lies horizontal. is clavicle. Clavicle को बहुत है specialties. Cremastic reflex में efferent क्या होता है? Genital branch of genitofemoral nerve. Afferent femoral only.
Both afferent and
No, afferent is different, Ray. Afferent is it not ilioinguinal? Afferent of cremasteric reflex. Okay. The innervation of cremasteric reflex is provided by sensory and motor fibers of genitofemoral. So both afferent and efferent of cremasteric reflex is genitofemoral only. Prove about external nose. Yes, external nose has good. Kamini Sakori says speed is okay, sir. All right. Are you not exhausted? Pakka? Kind of. Good.
Let's finish 500.
Huh?
500.
Final is ज्ञान अनंत है. हाँ, तो हम अभी संत बितना सत्संग में पढ़ रहे हैं. संत ही बोलते हैं, संत संत सेंट.
I don't know what हम सन्यासी हो जाएगा.
Hymen in child.
Hardly gets because it's situated deep.
Because it is situated deep. So many times hymen rupture के बारे में पूछेगा.
So what was the answer, sir? Knows the
Maybe
external knows the explanation.
knows the
That explanation.
two nasal bones.
Upper two
And upper two-thirds is bony while the lower third is cartilaginous. Don't ask me what are those two bones. No, neither.
Upper two-thirds is bony,
lower
lower
third
one-third
is
is
cartilage.
So A, B, D is
No, वो भूल जाओ, ये ए याद रखो. Two nasal bones. Yeah. About iliotibial tract, what is exact? It is inserted to lateral tibial condyle, derived from fasciolata, and receives insertion of gluteus maximus, iliotibial tract. About linea aspera, it continues as gluteal tuberosity. The linea aspera is a ridge of the bone on the posterior surface of the femur. Femur, you remember? पीछे एक linea aspera रहता है. True about popliteus is flexor of the knee, intracapsular origin and supplied by tibial nerve. एक आ गया? Where did this go? Check करो. Is she safe? That's my biggest. All right. Once more about popliteus. Flexor of knee, intracapsular supplied by tibial nerve. Right principal bronchus. It is shorter. It is more in continuity with trachea. That's the reason aspiration is more on right side. Scarpa's fascia. Is the deep fascia of anterabdominal wall? No. It forms the suspensory ligament of penis. Hey, Scarpa's fascia anterabdominal wall lo untayi kada. Recheck this. Scarpa's fascia is the connective tissue layer of the anterabdominal wall. It is thinner than Camper's fascia. And what is Camper's fascia? Camper's fascia. Fascia of the camper is thick superficial layer of anter-abdominal wall. So इसलिए answer should be A. A ना? Is it superficial or deep? Scarpa.
This came in last week, no?
Scarpa is extends superficially to the spermatic cord and the scrotum where it is known as dartos fascia.
So fascia of scarpa is deep membranous layer of the superficial fascia.
So it is superficial. It is not deep fascia, it is a superficial fascia. Camper also is superficial fascia. इसलिए D is correct. It forms suspensory ligament of penis. With regard to cystic hygroma, it is transilluminate.
Superficial fascia is composed of two layers. The outer fatty layer is known as campus fascia, and the more membranous inner layer is known as scarpa fascia. Both are components of superficial fascia.
Both scarpa and camper are the component of superficial.
Camper is fatty, sir. Outer fatty. Scarpa is inner membranous.
Outer fatty,
Inner membranous.
inner membrane. Inner membranous is scarpa. So scarpa
Both below the level of umbilical.
Scarpa forms suspensory ligament of penis. So who suspends penis? Scarpa. True regarding cystic hygroma, it is transilluminate and it develops from jugular lymphatic sequestration. About semitendinosus, it is proximal and distal, thin, and middle part of it is fleshy. And what is nerve supply? Semitendinous, tibial part of sciatic nerve. Tumor of the uncinate process of the pancreas compress which artery?
Superior mesenteric artery.
Superior mesenteric artery. 2-point discrimination is mainly function of, come on, Merkel disc. కాబట్టి అందులో ఏం అన్నాము మర్కల్ పెకినియన్ మీసనర్ రఫ్నీ ఎండ్ ఆర్గన్ ఫ్రీ नर्व एंडिंग्स वन क्वेश्चन सेंसरी रिसेप्टर्स उसके बिना नीट पीजी पेपर नहीं होगा so what is the type so Shweta says Scarpa is it deep, sir? No, it is superficial. In the superficial, there is one outer
Outer is
fatty camper, inner membranous scarpa.
Both are below the level of umbilicus.
Good. And type of collagen found in DC 3 and 4. Type of connective tissue present in the arrow marked. I don't know where was the arrow. Dense irregular connective tissue with high tensile strength is found in the areas of the body that are subject to tension and stress. Unpaired laryngeal cartilage क्या है इसमें? Epiglottis. At least if you know there are no two epiglottis, we will give you seat in NEETPG. Medial epiglottis, lateral epiglottis. Medial 2 epiglottis होगा. Medial 2 कैसे होगा? एक ही सेंट्रल स्ट्रक्चर है ना. Upper 2 posterior intercostal arteries arise from posterior intercostal arteries, superior intercostal artery, upper 2. Upward movement of thyroid gland is prevented due to pretracheal fascia, cervical fascia में pretracheal fascia.
Where is ligamental is an answer?
Huh? Pretracheal is a layer of deep cervical fascia that covers the trachea but does not prevent. एक बार देखो, upward movement of thyroid gland is.
Sir, for explanation no need, sir.
No, even that does not.
Next slide.
Take it granted. This answer is correct. Pretracheal. కుట్రాదు pretracheal prevents upper movement of the thyroid gland కాదా?
But sternothyroid muscles, strap muscles.
Superior extension of the thyroid gland is limited by the superior attachment of the pretracheal fascia and the attachment of all the strap muscles like sternothyroid is what we need to remember, doctor.
So also it is written, thyroid gland is invested in sheath derived from pretracheal fascia. This holds the gland onto the larynx and the trachea, so the thyroid follows the movement of larynx during swallowing.
Upward movement by ऊपर नहीं क्यों नहीं जाता. Ureteric bud arise from, come on, quick. Mesonephric duct. A part of mesonephros which forms from intermediate mesoderm. Boss, Wolffian or Mullerian में which is mesonephric, which is paramesonephric duct?
Wolffian is mesonephric.
Wolffian is mesonephric. Mullerian is paramesonephric. Wolffian होता है not in women but men. Mullerian होता है in the women but not.
Except prostatic utricle.
Only prostatic utricle is the derivative of Mullerian. हमको तो जरा इधर उधर का थोड़ा किसमिस नॉलेज मालूम है लड्डू में. Vasoconstrictor local anesthetic is, come on, the only one that doesn't require adrenaline. Cocaine को नहीं ऐड करते रिंग ब्लॉक में. You said cocaine? Wonderful. Vertebral artery of both sides unite to form? ఇన్నిసార్లు చెప్పిన తప్పు చెప్తే కనుక నేను చచ్చిపోతా. వైబ్రేషన్ సెన్సర్ డిటెక్టెడ్ బై Pacinian corpuscles. Vidian is also known as nerve of pterygoid canal. It runs in the pterygoid canal. It is a branch of maxillary nerve. What are the three nerves I told? Jacobson, Vidian, Arnold. Vidian is formed by the union of greater petrosal and deep petrosal. మళ్ళీ మూడునే అప్ప సూపర్ఫిషియల్ డీప్ ఇంకా డీప్ గ్రేటర్ గ్రేటర్ petrosal, deep petrosal, superficial petrosal. Vidian is formed by the union of greater petrosal and the deep petrosal. Superficial petrosal is a branch of facial nerve. Greater petrosal is a branch of facial nerve. External petrosal is the branch of glossopharyngeal nerve. So, anta petrosal. So, you need to be very clear about which petrosal nerve is the which one. भैया यूट्रस का वेट वजन कितना होता है? श्री कृष्ण तुलाभारम 1000 grams. What constitutes Malpighian layer? Spinosum and basal. ये दोनों को मिला के माल्फी बोलते हैं. कुल्फी नहीं, Malpighian. Then superior nuchal line is trapezius muscle. Anconeus क्या करेगा? Extension of elbow. इन्होंने మరి ఏం చేద్దాం 10 ఏళ్ళు ये खत्म नहीं करे तो आप you don't 10,000 questions है ना. 10,000 divided by बोलो 20 subjects. Worst case will be 500.
Mix లేవు కదా సార్ కంటిన్యూస్ anatomy వస్తుంది.
కలుస్తా ఉన్నాయి.
కలుస్తాం.
Any problem? Did you get anatomo toxic?
We are surprised there's no ops, there's no gynae.
वो सब आएंगे बेटा. जो हमको मालूम है वो पढ़ने में क्या मजा है. जो bispinous diameter, come on, ఆన్సర్ बोलो. ఎంత అంత కాన్ఫిడెంట్ కొట్టినావు రాంగ్. spine ischial spine. What is the capacity of stomach at birth? 50 ml. That's the reason large peg in foreign countries is 50 ml. India में 60 ml. And the content of femoral canal? In Taj Krishna Hotel, there is one waiter. So every time when we go out for a party, when he puts no large peg, one wink will make him to put another half peg. Later we'll give a good tip to him. So what is the content of femoral canal? Usme cloakwit lymph node will be there. What is the derivative of vitelline vein? Cardinal vein का derivatives क्या है? Vitelline vein का क्या है? IVC. You promised, no? You'll read cardinal veins and vitelline veins tonight only. What is the epithelial line of bladder? Transitional. What is the level of pulmonary valve? Third coxal cartilage. That's the reason, no? Pulmonic area, aortic area, वो सब कहाँ रहता? Second intercostal space. What is the level of spinoschapula? T4. What is the lining of lacrimal gland alveoli? Pyramidal cells. ఇంకొక 20-30 క్వశ్చన్స్ వేద్దామా? టైం ఏంటండి? 9:40 ఉన్నదా? ఇంకొక 20 నిమిషాలు, పావు గంట పోనీ.
Even answer చేసే good.
What time did we start today?
We started at 5 sir. 5 sir.
4 घंटे में आधा घंटा निकाल दो. 3.5 घंटे में हम 500, but per day 1000 is the plan to finish 10,000. Tomorrow we'll start a little longer, but अभी तो और एक 10-15 मिनट खत्म करके जाएंगे. उससे see, another subject will come where so we finished 1/20th of preparation, boss. 10,000 questions में 500 done. Right? 1/20th of preparation. That means 40 MCQs. 120th, 5%. Che? That means 10 MCQs in 200 guaranteed. Okay. Shweta says, sir, continue the Lebanese dance. Please don't stop. Lebanese belly dance. So let's continue for a while. What is the mean birth weight in India? I know you are all thinking what the birth in India mean, but this is mean birth weight. 2.5 to 2.9. What is the muscle composition of pursuant ridge? Superior constricting palatopharyngeus. What is the normal oxygen extraction ratio? कितना oxygen निकलेगा? Marwadi said 25%. What is the number of layers in great rumentum? 4. Good. It is a two-layered fold of peritoneum, two upar, two niche. What is the posterior relation of the neck to pancreas?
Common part.
अभी पढ़े ना?
हमें में भी आया था right?
नहीं, that is
Hmm.
uncinate, sir. Uncinate
You should know that
Uncinate
foramen of Winslow, Pringley maneuver, right? Pringles maneuver. Pringles maneuver means what? Whenever you are operating the abdomen, no, doctors. Portal triad है ना, Winslow, foramen of Winslow. You will apply the pressure so that you will avoid the bleeding from the portal vein. Portal vein is located anterior to the neck.
Sir, maybe pancreas is relations with plasma.
Hey, check it. Posture is the origin of portal.
Exactly.
Portal vein ecker
The origin is the neck of the pancreas. Origin of portal vein.
स्ट्रक्चर చూడండి एक बार देखो गूगल मियां को पूछो
Origin of portal vein. Origin of portal vein, pancreas के अंदर relation.
origin of portal vein
Actually, midgut is over behind the neck of the pancreas. Sir.
you see portal vein is formed by supramesenteric and splenic vein it is formed behind the neck of pancreas correct है అది వీడి చాట్ జీపీటీ గారి తప్పు what is the tensor of vocal cords tensor our pitch timbre how loud you will shout on the husband in the morning depends on cricothyroid so many times it was asked about the vocal cords what is the uppermost intercostal space used for liver biopsy seventh what is true about adductors of thigh adductor magnus is largest
Magnus means large.
most powerful adductor muscle adduction of the thigh is very important for a lot of things in life then what is true about chordae tympani
It's supposed
preganglionic parasympathetic afferent కదా తీసుకొని పోతుంది పోయి ganglion దగ్గర merge అవుతుంది chordae tympani is it takes the parasympathetic fibers to the submandibular ganglion what lies between middle and inferior turbinate middle meatus at what value of BMI anorexia nervosa patients will die 13 sweet 13 puberty
Swearing is danger.
what structure passes through quadrangular space yesterday I asked you no quadrangular triangular space మీరు చదవకపోయినా ఆ కీవర్డ్ కొట్టండి దాంట్లో సెర్చ్లో ఇన్ ద స్కోర్ యాప్ axillary nerve
Which prevents
when does basi occiput fuses with basi sphenoid too much 18 to 22 when group of muscles of dead body are in a state of strong contraction immediately prior to the death
Cadaveric spasm.
it's called cadaveric spasm where you are holding the NEETPG study material when you drown tomorrow in NEETPG then what is cave of Regius Meckel's cave is which nerve ఇది చెప్పకుండా నేను పోతే చదివింది వేస్ట్ which cranial nerve Meckel's cave is the place where the ganglion of which nerve is sitting
yes, sir, trigeminal.
Huh?
Trigeminal.
మరి చెప్పకుంటే ఎట్లా 1+1 వాష్ మే లేనా cave of red GS is present in front of bladder between the symphysis pubis and umbilicus. Human body has many caves, canals, tunnels. What is the highest oxygen concentration in fetal circulation? IVC में. Where will be the placement location of auditory brainstem implant? Recess of fourth ventricle. Which artery is located in anatomical snuff box? ये तो सब लोग आंसर करते हैं. Radial artery. ये भी नहीं आंसर कर पाए तो you are lesser than amoeba. Diatom. Which bone is first to start ossifying? Mandible. Which fracture of Peter's bone will cause facial nerve between longitudinal and transverse? Wolffian duct derivative is appendix of epidermis. Which is the first organ to putrefy? నేను మొన్న ఫారెన్సిక్ putrefy నేను మొన్న ఒక లిస్ట్ ఇచ్చిన కదప్పా ఫారెన్సిక్ మెడిసిన్ నోట్స్ మే brain the first because of its high fat content and presence of enzymes. See, what is the order? What is the last organ to putrefy in women, men? First organ. మీరు होमवर्क పెట్టుకోండి putrefaction. देखो forensic का मैं लिस्ट दिया ना उसमें what number चल रहा है order of priority in the 1151 topic list. Second is putrefaction. మీరు టాప్ 20 టాపిక్లు చదువుండ్రి 60లా ఓ హుషార్ ఉరుకుతారు ఇక గుర్రం లెక్క. Which is the first organ to putrefy? Brain. Which is the most abundant collagen? Phenocartilage, hyaline cartilage. Which is the thickened nerve shown here? Okay, I don't know what was shown. Great auricular. At least if you can recognize, too much no, ear ke piche hai, to great auricular. What is true about synovial joint? Hyaline cartilage covers the articular surface of all synovial joints. Which layer of the scalp is vascular?
Superficial facial.
ఎపోన్యూరాసిస్ లో వాస్కులర్ ఎట్లుంటుందప్ప లిగమెంట్లు వాస్కులర్ ఉంటాయా టెండాన్లు వాస్కులర్ ఉంటాయా ఎపోన్యూరాసిస్ వాస్కులర్ ఉంటుందా ఎట్లా అధ్యక్ష మీరు ఇట్లా అంటే which leaves the pelvis okay pelvis को छोड़ के कौन जाएगा sciatic nerve छोड़ के जाएगा which lymph node drains upper vagina and cervix external iliac very good sant mithuna satsang which opening of upper end of esophagus which muscle causes opening of upper end of esophagus bolo come on cricopharyngeus of the inferior constrictor which muscle causes supination of forearm ye to bolega biceps brachii which muscle is attached to the disc of temporal mandibular joint late నేను చెప్పినా లేదా lateral pterygoid medial pterygoid buccinator masseter ओ संत जी जरा ये पढ़ के जाना परीक्षा को. Which muscle of larynx is not supplied by cranial? हाँ, ये तो चिल्लर क्वेश्चन हो गया. Which muscle of the arm has additional supination action? Biceps brachii. Which muscle originates from the tendon of other muscle? Lumbricals. Which nerve is compressed in pregnancy puerperium? Which nerve is preserved in dissecting superficial and deep lobes of parotid? Superficial parotidectomy, deep parotidectomy, total parotid. So you should know. Which does not directly drain into right atrium? Does not drain directly into right atrium. It drains into left atrium. Great cardiac need. You said great, huh? Satsang. Which of the following dorsiflexes the foot? कम से कम posture नहीं बोले तो you attended Murli Bharadwaj coaching. Epidermal layer is a dead layer. Corneum. Which has direct innervation from sympathetic but no parasympathetic? Direct innervation of sympathetic but no parasympathetic. Skin and the palms, no. Which is the branch of inferior mesenteric artery? మళ్ళీ వస్తుంది మిసెంట్రిక్ ఆర్టరీ ఒకటి వచ్చి కూర్చుంటే పచ్చిలా ఇప్పటికిప్పుడు కథం చేసి పారేయండి. Sigmoid. You said sigmoid before seeing answer.
Yes, sir.
What is the derivative of paramesonephric duct in male? Prostatic utricle. So you'll be waiting for that in exam hall. What is the derivative of rat case pouch? Hey? Pars tuberans. Which is the derivative of ventral mesogastrium? Ventral and पीछे ना आगे ना. अरे रामा, lesser omentum. क्या है उस्मानिया? Labile cell. Labile cell. There are three types of cells: stable, labile, permanent. Growth rate, multiplication, permanent is nerve cell. General pathology में labile cell, stable cell, permanent cell. रॉबिन्स बोल के बुक मालूम है? दीक्षा रॉबिन्स बोल के कभी मल्ला रेड्डी में, नल्ला मल्ला रेड्डी में, तेल्ला मल्ला रेड्डी में कभी पढ़ाया? Hey, next time onwards, before I start, give admission to coaching my push stop. 10 questions. Narayan Reddy is a textbook of which subject? वो आंसर किया जनरल मेडिसिन. ओके, इसको 10,000 फीस एक्स्ट्रा. वो पूछेगा सर काइकू सर आपको पढ़ाने के लिए मुझे स्ट्रेस अल्सर्स आता है, उसका ट्रीटमेंट लेना पड़ता, 10,000 एक्स्ट्रा. हाँ, लेबाइल सेल. हाँ बोलो. सरफेस एपिथेलियम. It is constantly turning over and being replaced. Which is a marker of annexin 5. ఏం ఆన్సర్ గుర్తు రాకుంటే ఆన్సర్ ఏంటి? Exactly. If nothing comes to your mind, answer is apoptosis. देखो पैथोलॉजी में देखो apoptosis मेरे दिया हुआ प्रायोरिटी लिस्ट में कौन सा है? 4th. That means tomorrow 6 or 7 questions which are going to come in pathology in the list I have given to you, top 20 में से आ जाएगा. आप बुर्र 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 रिविजन करना है. Annexin 5 is the marker of apoptosis. Which is a pneumatic bone? Which is a remnant of umbilical artery. Amma. ఇది చెప్తే ఇక సూపర్ ఇక మీరు. జల్దీ. Medial umbilical ligament. Vinisha, there are two ligaments. Median umbilical ligament. Medial. L is for what? N is for what? I already discussed, no? Medial is umbilical artery. Ligamentum arteriosum is ductus arteriosus. Ligamentum teres is umbilical vein. Okay? Ligamentum venosum, ductus venosus. Medial is remnant of umbilical artery. Which is a retroperitoneal structure? Funda question. Huh? చెప్పండి. వాట్ ఇస్ ద ప్రాబ్లం? లేట్గా చేంజ్ అవుతుందా? ఏం చేద్దాం మరి? ఇన్ని క్వశ్చన్లు ఎప్పుడు కట్టుకోలేకపోతుంది యూట్యూబ్. చలో ఫాస్ట్. యూరేటర్ వస్తుందా? Which is a skeletal derivative of second pharyngeal arch? Stapes. Which is a conjoined twin? Is a type of conjoined twin? Thoracophagous. दिल लगा के दोस्त बन गया. మళ్ళా ఇంకొకసారి ట్విన్నింగ్ చదవాలి. టైప్స్ ఆఫ్ ట్విన్నింగ్, డైజైగోటిక్, మోనోజైగోటిక్, అంత చెత్త. Okay, what is common between medial and lateral plantar arch? Plantar fascia. Then which is derived from? No. First arch. Starch kaadu. Both maxillary and mandibular. Once more, cleft lip, cleft lip, cleft palate. Cleft lip is a fast, cleft lip, cleft palate. Sure, short question आएगा. Without that, examiner कहीं भी बाहर नहीं जाएगा. Which is not a branch of first part of maxillary artery. Amma, maxillary artery, all branches, and first part say what branches, second part say what branches. How are they divided into branches? Please add maxillary artery into your list. Agreed? Maxillary artery, meningeal artery కాదమ్మా, maxillary artery. Correct. Middle meningeal, accessory meningeal, inferior alveolar artery are all the branches. The greater palatine is the branch of second. మీరు maxilla ఇక్కడ ఉంది, palate అక్కడ ఉంది, దీంట్లో నుంచి అట్లా పోతుంది, అయ్యో అనుకుంటురా. Greater palatine artery is a branch of maxillary only, but it is a branch of second part. Understand? But anyway, homework urgent. Aesop, which is not a congenital anomaly. I mean, कभी lighter vein होना है, which is not a derivative of foregut. You know, cecum is a part of colon, or small intestine. Oh no. Which is not diarthrosis.
I know skull is.
Skull sutures. Not are they? Elbow, interphalangeal, hip joint. Diarthrosis allows the movement in two directions. Ko diarthrosis bolte. While skull sutures are immovable, which is not seen in anterior mediastinum, which is seen in posterior mediastinum. Neurogenic tumor. Which is not seen in anterior mediastinum, neurogenic tumor. Which is not seen in fingerprints,
Circles.
Circles. Loop, whorl, arch are all seen, which is not a muscle in superficial anterior compartment of forearm.
Palmar is long.
Superficial anterior compartment means it may be flexor pollicis longus. Superficial anterior compartment forearm are flexor carpi radialis, digitorum superficialis, palmaris longus. Flexor pollicis longus is in the deep anterior compartment of the forearm, which is not a part of ethmoid bone. Uncinate, cristagalli, agarnasi, they are all the part. It is a part of the lateral nasal wall, which is present in cornea. Chondroitin is present, heparan sulfate is not there. Which is the related to mediastinal part of the right lung? SVC. You told her? Good. Very good. Okay. So, 150 to 560 means 500. No, 400 only, no. They revised 400 questions.
500 questions they completed in 2 days yesterday.
Oh, no, we are not bad.
Okay.
This is called blood bath, brain bath. So thank you so much to everyone for attending the session, doctor. Let me promise you, this is the most effective, productive, result-oriented time you are spending with Dr. Murli Bharadwaj. Rosanna, next 8 days we will fight together. टेंशन कुछ भी नहीं है, कल और लंबा पढ़ेंगे और आपके दोस्तों को भी बोलना आने के लिए. And it is very enjoyable because what all that we read in last 6 months we are revising with PYQs of the 10 years. So thank you all. Don't read it. మొదలు పెడదాం రేపు. అదే మీరు పొద్దున్నే 10 కల్లా వచ్చేయండి. వచ్చేసి మంచిగా 1 o'clock వరకు దంచండి, చదవండి. నేను 1 కల్లా వస్తా. మనం 3 hour సెషన్స్ కొడితే 1000 కథం అయిపోతాయి. One question.